Welcome, and thank you all for joining us today for our Entrepreneurship Issue Forum on supporting entrepreneurship, supporting families, considerations for policy, and interventions around caregiving. I'm Jessica Looze, a Senior Program Officer here at the Kauffman Foundation, where I lead our translation work, connecting research and practice. I'm so pleased to be part of this conversation today as we hear from a number of experts about this timely topic. Many of us gathered today, myself included, have found ourselves juggling the responsibilities of our paid work with the responsibilities of unpaid care work in new ways. Care work might look like caring for young children as child care centers have closed. It might look like helping educate children who are attending school remotely. It might look like caring for relatives who are suffering from COVID or other illnesses. Perhaps we are unable to provide care in ways we are used to as COVID-19 has kept loved ones isolated. In many ways, COVID-19 has both highlighted and exacerbated the tensions between paid work and unpaid care work that so many of us experience in our daily lives. Today's topic is also particularly fitting during a week in which we remember Ruth Bader Ginsburg, someone whose life work was in many ways at the intersection of this relationship between paid and unpaid work. Ginsburg worked seemingly tirelessly to ensure that both women and men could engage in both the market and at home, and that their contributions would be recognized and valued in both spheres. So here we are today to talk about these issues together. We will hear from experts whose work touches on today's theme from a variety of perspectives. Our first panel will address the landscape of caregiving in the US and what it means for entrepreneurship. When we think of caregiving, we often think of childcare, but caregiving is provided to and by individuals across generations, to aging parents, sick spouses, terminally ill siblings, individuals with disabilities, veterans returning home with serious injuries. The list is long, and the work of caring is hard, demanding incredible physical and emotional capacities. Yet care work is often invisible, unrecognized, and undervalued. Caregiving is often underpaid, and even when it is paid, wages in jobs that involve providing care are lower than other occupations. We also know that care work is disproportionately done by women, and when it comes to paid care work in particular, much of this work is done by women of color. With regards to unpaid care work that takes place at home, women tend to spend more time than men caring for children and performing housework. We've seen gender inequalities in caregiving during COVID-19, as survey data finds mothers more often than fathers report spending more time homeschooling their children and helping them with distance learning. Time spent in unpaid care work has impacts on time spent in paid work. Recent survey data from the census finds that mothers between the ages of 25 and 44 were nearly 3 times more likely than fathers in the same age range to report that they were not working due to COVID-19 childcare issues. Thinking about entrepreneurship specifically, we know that women business owners more often concentrate in retail and service industries, where businesses are typically smaller in terms of both employment and revenue. These are also the businesses that have been hit particularly hard in the current recession. Our first panelists will set the stage for today's forum and take up important questions as they discuss what the research evidence suggests about caregiving in the US, what it means for individuals and families, for labor market opportunities, and for entrepreneurial activity and outcomes. We will next turn to our roundtable conversation and hear from individuals representing a variety of programs and organizations from across the US, discussing framing conditions for policy and program interventions. Participants in the roundtable will share their experiences of working on the ground in program and policy spaces to create greater economic opportunity for individuals and their families, specifically when it comes to the issue of caregiving. They will discuss the priorities, constraints, and needs they face in their work and how they address these. The roundtable will provide a wide range of perspectives, ideas, and experiences related to today's theme of supporting caregiving and supporting entrepreneurs, including entrepreneurs who themselves might be employers working to support their employees who have caregiving responsibilities. Finally, our closing panel will bring a comparative perspective with a discussion of what is happening in other countries around caregiving, gender equality, labor market participation, and entrepreneurship. What do policy and program approaches look like in other places around the globe? How do these work to encourage entrepreneurship or discourage it? How is care work organized in other countries? Who is providing this care? What types of supports are in place? How successful are these supports? And who are they successful for? Together, we will consider what we might learn from these models and approaches. Today's forum will explore key issues facing entrepreneurs and provide multiple perspectives about how to deal with those issues. We host this forum to provide a platform for discussion about how to solve problems, and the Kauffman Foundation takes no political position or legislative position on these discussions. I would like to thank each of today's panelists for taking time out of their very busy lives to share what they have learned and to raise important questions for us all. And with that, I would like to introduce our first panel this morning. Sharing with us on the landscape of caregiving in the US and what this means for entrepreneurship will be a panel that consists of Dr. Elise Gould, a senior economist at the Economic Policy Institute, Dr. Tami Gurley, an associate professor at the University of Kansas Medical Center, and Dr. Jessica Milli, a research director at the Association for Enterprise Opportunity. Each of these panelists will be sharing with you for about 7 minutes or so, and at the conclusion of each of their presentations, we will open it up for a moderated Q&A. If you have questions as they are speaking, please feel free to share these in the Q&A, and I'll be moderating a group discussion after each of their presentations.
Good morning. Thank you for inviting me to participate in this important session. In my time, I want to make 4 basic points. The first is that there is a high demand for caregiving. We know that in the United States, millions of children, parents, grandparents, and other family members require care, and millions of adults in this country are providing that care. And this caregiving takes time. It also takes other resources. So that's point number 2, caregiving is expensive. I'll expand on that a little bit more later, but I think we all understand that caregiving is expensive. Point 3 is if we put point 1 and point 2 together, we know that caregiving responsibilities put enormous strain on families, particularly women, which is an obstacle to finding work in the formal labor market, securing full-time employment, or even starting a business. And COVID has exacerbated these challenges. Point 4, better publicly financed child and elder care would allow lots of people, again, overwhelmingly women, to have more freedom to work or start businesses. A robust care infrastructure is necessary to support care workers as well as those potential entrepreneurs. So why is caregiving such a pressing issue? For parents, they need to have more hours of work. We've had 4 decades of growing wage inequality in this country. We've had slow growing wages for the vast majority of workers. It simply takes more and more hours for families to afford the basic necessities. Women entered the labor force in search of opportunities, and because of the rising cost of living, think of things like housing costs, healthcare costs that have risen faster than overall inflation, families need to put in more hours in total. Thus, there's increased demand for early care and education. And on the flip side, there's a growing burden of caring for older relatives, and that is astounding in this country and growing every year. In total, nearly 15% of the US population is 65 and older. That's growing about 2 percentage points over the last 25 years, and it's continuing to grow. For every 4 residents of working age, there is 1 of retirement age. And many of these older people, or about 14 million, can't live independently or care for themselves. So there was a huge problem. Now let's talk about the costs. I know a bit more about childcare, so I'm going to start there. The costs of childcare are high, but they do vary significantly across the country and obviously by age of child and how many children you have. So let's just pick a state with middle of the road costs, say Minnesota. In Minnesota, the average cost of 4-year-old childcare is over $1,000 per month. That's over $12,000 per year. For an infant, it's more than $16,000 per year. So that's over $1,300 a month. We talk a lot about middle-class families trying to save for college. They presumably have 18 years to save for college, but when you have a new infant in your family, costs for early care are about $5,000 more per year than in-state tuition for a 4-year public college in Minnesota. And Minnesota is not an exception here. I'm not cherry-picking Minnesota. In 32 other states, 1 year of infant care is more expensive than college. We think of rent as the most expensive cost families face, rent or mortgages, but infant care costs 30% more than average rent in Minnesota, and that's just for one child. And this isn't just a problem for low-wage families, though obviously it is a huge problem for low-wage families. Median family income for families with children is about $75,000 in Minnesota. That typical family would have to spend more than 20% of their income for one child. It's recommended that you spend no more than 7% of your income for child care expenses. According to that Health and Human Services standard, less than 6% of Minnesota families can afford infant care. So it is out of reach for many middle-income families. And caring for children is a considerable barrier to women's work. In peer countries where parental leave is guaranteed by law and governments ensure free early care and education, women work at a much higher rate than in the United States. In the US, after rising for decades, women's labor force participation started falling off in the 2000s. This was not true in places like Germany, Japan, and Canada, where women kept increasing their participation in the labor market. And it's not only the burden of caring for children that is a substantial barrier to labor force participation. About a quarter of women 45 to 64 years in age are caring for an older relative, and many are caring for both an older relative and children. So really sandwiched between having to care for many family members. And the demand for caregiving isn't going to lessen for those older parents and grandparents. By 2030, more than 1 in 5 Americans will have reached retirement age. On average, they will need 3 years of long-term care, and 1 in 5 will need more than 5 years. So the need is great. It's not surprising then when you look at occupational data from the Bureau of Labor Statistics that caregiving occupations are one of the fastest growing, those that are going to be fastest growing in 10 years to come. So what happens to these caregivers in the labor market? Well, if you have caregiving responsibilities, they tend to cut back on their hours of work in the labor market. Some leave their jobs altogether. 80% said they missed work for caregiving responsibilities, and about 10% said it caused them to lose a job. That means lower income and less retirement security for themselves when they age. And unlike our peer countries, so those in the OECD, let's say, here in the US, we make substantially less investments in caregiving. In the US, we spend less than 1/3 of what the OECD average spends on long-term care. And these investments matter for meeting the needs of an aging population, as well as the challenges faced on caregivers who are also trying to juggle their own employment. That's long-term care. The same is true for early care and education. The US spends less than half of the OECD average. Investments in early care and education won't just help parents today, which is obviously really important, but to the extent that we subsidize high quality early education, this will pay dividends in the future, huge benefits down the road in economic growth and the labor market. And you may be more familiar with problems in the labor market with regards to healthcare and job loss. There's a lot of research out there. The daunting cost of healthcare makes it more difficult for workers to go out on their own and start a business. Thus, it's the importance of universal healthcare coverage, a topic for, I'm sure, another conference, many other conferences. Here in the US, we have much lower rates of small business development than in our peer countries like Spain, France, and Germany. The US is among the last among members of OECD in terms of its share of self-employment. Self-employment and entrepreneurship allow for flexible work schedules that caregivers need, but they don't provide the benefits of a regular job, which offers the financial stability of a regular paycheck and often benefits. Better publicly financed child and elder care would allow lots of people, again, overwhelmingly women, to have more freedom to work or start businesses. So what does that look like? Caring across generations in partnership with other groups have provided a useful and a comprehensive list of policies that would not only help provide care for millions who need it, but allow many workers to become entrepreneurs and start businesses, perhaps within the caregiving sector, as well as free up millions of others to work and start businesses in other fields. So here's their list, and I'm sure you're going to hear a lot more about it later. I believe you have a panelist in one of the future panels from Caring Across Generations. Talk a lot about universal childcare, expansions of well-compensated early education centers, paid family and medical leave for all, including paid sick days and paid time off, universal long-term support services that would improve quality options and pay, support for family and particularly sandwich generation caregivers, providing compensation and health insurance, fair pay and protections for care workers in general, raising the federal minimum wage, for instance. Basically, social insurance and public investment are complementary to economic dynamism and support the growth of entrepreneurship in the United States. Thank you.
Thank you, Dr. Gould. And now we'll be hearing from Dr. Gurley.
Hello, thanks for having me today. And I'm going to kind of bounce between a couple different places, talking about some research, some past research and some ongoing research, and mostly focus on women and childcare issues, just because that is where we started, not necessarily because those are the big issues. So I want to talk a little bit about an older study, a time use study, but I think it corresponds very closely to some of our more recent work, and as we talk to entrepreneurs, what we're finding. And so this is a study using time use data from the American Time Use Survey from the early 2000s, and comparing self-employed women with wage and salary women and self-employed men and wage and salary employed men, and just looking at how people spend their time. So what people do is they fill out a diary of how they've spent their entire day, and then it's broken down into different categories. The sample size is good. You have about 13,000 people per year. It's a subset of the current population survey, so you really can get an idea of more broadly how people are using their time. And I think completely consistent with what's been said, self-employed women had less work time, right? So their work time per day on average was 6.2 hours, where the wage and salary women were at 7.3 hours. The self-employed men were at 7.6 hours, and wage and salary men were at 8.2 hours. So across the board, men had more work time than the women in the time use survey. So when we limit it just to people with children, and we look at how much time is spent in childcare, we find that self-employed women were spending 14 hours in childcare, wage and salary women 11.9, and then for men, those numbers were again lower than for either set of women, 11.2 hours for the self-employed men and 9.8 hours for the wage and salary men. So in both instances, the self-employed, no matter what their gender identification was, spent more time in childcare, but the women overall, no matter which employment sector they were in, spent more time in, and this is primary childcare, right? This is time spent directly caring for children. The differences were also pretty shocking when you looked at secondary childcare. So this is childcare where maybe the childcare is not your primary purpose at the moment, but you are in the same place as your children. And currently, I have 3 children doing school downstairs, so some secondary childcare perhaps going on. So the self-employed women spent about 5.7 hours in secondary childcare, where the wage and salary women were 4.6 hours, and then the men were under 4 hours, regardless of whether they were in the wage and salary sector or the entrepreneurship sector. And I think this kind of highlights a tension that I've been curious about for a very long time in terms of thinking about entrepreneurship, in terms of thinking about women and how they're meeting their potential in the labor market, and whether that's through the entrepreneurship sector or through the wage and salary sector, through self-employment or not. And so one theme that keeps coming up is that the women may be choosing to be self-employed for lifestyle issues, and some of these time use patterns seem to support that they value the flexibility in self-employment. But also there seems to be evidence out there that some women choose self-employment because they want to build a business and grow a business, and they And so I think sorting out these issues and how we set policies to support people so that they can contribute to the work sector in the way that best suits them. So the last thing I want to mention from that Tami study is that it differs by income level, pretty shockingly. So if we look at our lowest income category was less than $20,000 a year. And those folks, for secondary childcare, the women, the self-employed women, spent 6.6 hours in secondary childcare. For the greater than 100 or equal to $150,000 a year, that number was 4.9 for self-employed women. And so across the board, you have, and it's a gradient all along the income sector. So the lower income households are spending more time in childcare. The higher income households are hiring some of that out. And so, you know, how, in terms of how we support people so that they can contribute in the work sector, I think there's important differences based on the opportunities you have, based on different employment levels. So we also looked at some data from the longitudinal study of youth. And so these are people that their first interviews were when they were age 14 to 21. And they ask, how many children do you expect to have, right? And then we can follow them 30 plus years and see how many children they actually have. And so our question was, are those gaps between what you expect when you're younger and what you realize when you're older in terms of your family outcomes, are those gaps the same for people who are self-employed and for women and for men? And we specifically focused on differences by education. So we looked at men and women with different education levels, those with professional degrees and those who didn't have professional degrees. And we found across the board that the difference between expected and actual number of children is highest for women with professional degrees. So the gap wasn't as big for men. And actually the women who chose self-employment who didn't have professional degrees tended to have more children, not than they expected, but they were much closer to what they expected. And so I think it begs the question too, as people work their way through life and maybe make family priorities early on, is it that those women are choosing the self-employment sector because that's the sector that fits their family and they made the family decisions early on, or would have they chosen something different if they had had other opportunities for support early on? And so I think sorting out some of those issues about which decisions are coming first, or the education decision, if you make the education decision early on, then that affects your family decisions later on. So we want to look at the timing of some of these issues and see if we can sort through that. And the last thing I have to talk about, we just wrapped up some in-depth interviews with 4 growth-oriented women entrepreneurs and talking to them about their experiences and how they made their decisions. And some interesting things came out of this, and I don't think this is going to be a shock to anyone who has worked in this research space, but you know, a lot of their reasons for choosing to start their own business had to do with the structure of the wage and salary sector. So they observed unequal pay, or they felt like they had lower growth opportunities as women in the wage and salary sector. Also that the work structures, the hours, the lack of flexibility just didn't work with some of the other lifestyle choices. And whether that was one of them actually cared for an elderly family member. And then I believe 3 of the 4 had children. And so, you know, either way, those work structures were just too binding to achieve what they wanted. But then what we also found in talking to them is that this decision to start a business was also very intentional, and they had goals. They had vision and they had goals, and they wanted to build this business. And so one of the things that they kind of actively, as a group, resisted were some of these gendered norms out there looking at their business as something like a side hustle or calling them on the mommy track, right? And so I think some of their efforts were less appreciated maybe in the broader world because people just saw this as a way for them to deal with their family issues and not necessarily focus on their business enterprise. But they definitely mentioned the family leave policies and lack thereof in the US as a deterrent for choosing to start their own business, right? There's some security in that you have the FMLA policy and you have some policies in the wage and salary sector that you don't have in the entrepreneurship sector. So again, we get these themes of, is it necessity or opportunity that is driving the decisions? And I think overall, kind of consistent evidence across the different data sources, but the questions still remain. I think there's still a lot of digging into this about how do we best support people to achieve their family goals and to achieve their work-related goals, and just need a probably deeper understanding of how these decisions are made and when and where they're made to do that.
Great, thank you so much, Dr. Gurley. And finally, Dr. Jessica Milli is going to share with us.
Thanks, Jessica, and thanks to the Kauffman Foundation for having me here today. I'm really thrilled to be part of such an important and timely conversation. The privilege of going last on the panel is that you get to hear how much you overlap in your thoughts and ideas with your fellow panelists. So I'll try not to repeat too much of what others have said. One of the things that I do want to add to from the previous panelists is building out some of this discussion about the landscape of the caregiving infrastructure in the US. So Elise did a really great job of talking about, the broken childcare infrastructure, and Tami to some extent mentioned the paid leave gaps. I want to dive a little bit deeper into the state of paid leave in the US first before going into what that means for entrepreneurship. As many of you already know, the US is the only developed nation in the world that does not have paid family leave for parents of new children or adopted children. To some extent, we are able to fill in some of those gaps with the FMLA, as Tami was mentioning earlier. But due to all of the restrictions and eligibility requirements, only about 60% of workers actually qualify to take leave under FMLA. So there's still a huge gap there. And also, according to the National Compensation Survey done by the Bureau of Labor Statistics, I think in 2019, only about 18% of the private sector workforce in the US had access to some kind of form of paid family leave. So there's a huge gap there in terms of who has access to these supports that can help them meet their caregiving responsibilities while also juggling employment. And these sorts of things are really important now, given the COVID-19 pandemic. Paid leave particularly is going to be really important in these times because you have a lot of folks who are juggling, trying to manage their work and care for people who are sick. So just wanted to keep that top of mind. So this lack of infrastructure and expectations that women tend to prefer to focus their attention on their families rather than their careers can lead to biases in hiring and promotion that really hold women back from opportunities in the labor market. So, what does this mean in terms of entrepreneurship? Well, when I first started doing research on women's entrepreneurship, women business owners, I was really surprised to find that women-owned businesses were growing in number at rates that were far surpassing those of men-owned businesses. I know American Express puts out a report every year on the state of women-owned businesses, and in the most recent report, they found that between 2014 and 2019, the number of women-owned businesses grew by 21%, and that's compared with the overall rate of all businesses of 9%, which is really phenomenal. But what surprised me more was that this growth was even more pronounced among businesses owned by women of color. So for example, Black women-owned businesses increased their representation among business owners by 50% over that same time period. And so in a world where women face myriad, social and economic challenges, this seemed like a really bright spot to me. And I was really excited to see this. But like Tami, I think she was saying this earlier, as I want to do as a researcher, as I dove deeper, I began to wonder whether this huge rise in the number of women-owned businesses might be driven, at least in part, by their more limited opportunities in the workforce, driven by that lack of caregiving infrastructure. There really hasn't been a whole lot of in-depth causal analysis of the reasons behind these trends in women's increased participation in self-employment. But existing data do suggest that we might be onto something. And I know Tami talked about some of this evidence earlier that she's been working on. But just to add to that, the annual survey of entrepreneurs, for example, asks owners of employer firms why they wanted to own a business. And among women business owners, particularly, the ability to balance work and family and the ability to have more flexible hours in the workday were the most commonly cited reasons for them wanting to start their business. And when you contrast that with the responses among men-owned businesses, I shouldn't say it's surprising, it's not surprising. But men-owned businesses, their top two reasons were wanting to be their own boss and having a greater income. So again, that just goes to show you, how that lack of caregiving infrastructure might be influencing more and more women to pursue self-employment as an alternative to wage and salary work. But while self-employment can provide that opportunity for people to meet their caregiving responsibilities while also providing economically for their families, the caregiving responsibilities that they do have could also be holding them back as entrepreneurs. And so this is another area, I think, where additional research and data is going to be super helpful, because there's, again, not a lot of trusted information out there on business owners who are caregivers. But what we do know is that, women business owners, more than their male counterparts, are more likely to work in their business part-time. And they're also more likely to have home-based businesses. So again, suggesting that they might be using entrepreneurship, self-employment as a means of, getting that work-life balance, being at home, and being able to take care of their children while also, earning a living. There are obviously other factors contributing to this, but as a result, women-owned businesses tend to earn less. The most recent stat that I've seen, women-owned businesses earn approximately 23% of the revenues that men-owned businesses do. And again, not terribly sure to what extent these caregiving responsibilities might be contributing to these trends. But again, the limited data that we do have do seem to suggest that there might be something there. And, I would be remiss to, if I didn't point out that this kind of arrangement might be exactly what some caregivers want. And that's great. But I think the bigger picture question is, what would these caregivers have done if they had more freedom and the care infrastructure actually worked for them? And I think these are some of the same questions that Tami was bringing up in her remarks. Would they have turned to entrepreneurship to begin with if they had this care infrastructure that worked for them? Perhaps. We do know that passion and desire to create something new for themselves are also major factors that are driving women to start businesses. And if they did pursue entrepreneurship anyway, would they have been able and willing to devote more time to their businesses? And would they earn more as a result? Would they have chosen a different industry or set up a physical location if they had that infrastructure there? And I think this line of inquiry is really important because it really gets at the heart of that question of what is the cost of not properly investing in our nation's caregiving infrastructure. Another thing that I think is important to focus on, and another way that I see these caregiving responsibilities and that limited caregiving infrastructure holding folks back from achieving their full potential, is through limiting their ability to access assistance and support for their business. We know from our programmatic work at AEO that business support programming tends to be more effective when it combines education, access to capital, and network building opportunities. And so these types of programs tend to be multi-week, multi-month programs that meet in person and often very regularly. And they provide that comprehensive suite of services to help support those businesses. But unfortunately, for some, a lack of reliable and affordable childcare may mean either not being able to attend sessions or frequently missing sessions. And this is particularly true for single mothers and fathers who are the sole caregivers for their children. And I don't think I've seen any studies on the impact of childcare on this particular population, but I was reminded as I was thinking about my remarks here of some related research in the job training field, which shows that the need to care for a family member was the most common reason cited among job training participants for why they were considering dropping out of the program. And further, and this is a study by the Institute for Women's Policy Research, by the way, about a third of the participants that were surveyed, those who had children, a third of them said that they could not have attended the training if they did not have childcare assistance. And this really scratches the surface too, but these data points really highlight the need for program leaders to think even more deeply about the unique needs and contexts of the entrepreneurs that they're serving and how they can meet them where they are so that they can bring their full selves to the program and really truly benefit from it. And the last thing that I'll say, and I'm sure we'll talk more about this later, is that all of these things that we've been talking about have really been underscored by the COVID-19 pandemic. You know, business owners and employees alike are really feeling the strain of the lack of the caregiving infrastructure in the US now more than ever. And those who can conduct their work at home are struggling to be productive while also taking care of their children and helping them navigate distance learning, as Jessica was saying earlier. And those who have returned to work are finding it even more difficult to access and afford childcare because many facilities are either shut down or operating at limited capacity. So really, I think this is our opportunity to sit down, think things through, make change, and really get things right. Thanks.
Great. Well, thank you all for raising some really timely and important issues, and I look forward to a great discussion now. We've had a couple questions come through in the Q&A. I would encourage our viewers to please insert more questions as they come to you and as we're having this conversation. I really appreciated that all of you spoke about care infrastructure and what that looked like, especially across the United States as we think about the need for paid leave and childcare cost, cost of elder care. I'm curious if any of your work has examined variation across states, and particularly looking at what states are doing things well in terms of, you know, childcare cost and paid family leave, and really encouraging. You know, I had my children in Rhode Island, which is one of the few states in the United States that provides maternity leave, paid maternity leave through the disability program in the state. So I'm curious what this might look like across states, and what this means for, you know, families' finances and decision making, labor market participation, entrepreneurship. If any of your work has examined this.
Sure, I'm happy to start. I think that you've pretty much hit the nail on the head. There are some states that have more protections than others. So there is a large amount of variation. Some states, particularly when you're talking about paid family leave, paid medical leave as well, right? So you're trying to care for maybe an aging parent or a spouse or another family member. So it covers not just the parental part, but also the medical part for family needs. And so that's important. You're seeing that in several states across the country, and then there's good evidence that that does help provide that support that those workers need at that time. It's important that those provisions also include sufficient salary replacement. And you need that salary replacement not only to make sure that people can actually afford to stay home, but also to help equalize the gender gap in those caregiving responsibilities. So you need to encourage men as well and change the culture so that men are also taking that caregiving leave. So that's important on parental leave. I think also on childcare and early care and education, we have seen some states and some cities start expanding their public education system down to lower ages. And so universal pre-K or education for 3 and 4-year-olds that have happened in some cities and states. And you can see there's some preliminary research that shows, let's say in DC, in Washington, DC, that you can increase women's labor force participation and then have more opportunities in the labor force for starting businesses and the like, if you have those provisions in those places.
I'm just the economist by nature, and so I always think about maybe some of the, like, what are we missing? Where might policies not be working together? And so, you know, I think that there've been successes in, like, the state of Kansas actually are providing paid leave for primary and secondary caregivers. You know, that's great. I also think we miss some of the most vulnerable households. So if you're looking at, you know, children who are most likely to experience adverse childhood experiences or these things that are going to carry with them forward in life, even paid leave, you know, the FMLA, you have to have a pretty stable job and you have to work quite a few hours to qualify for that. And so the amount of income that we're talking about in terms of income replacement for lower income parents is really not that much. But then you run into, there's a program that I just happened to know about in Lawrence, Kansas, which I find kind of innovative. They're offering paid, and at this time it's mostly maternal leave to lower income moms, and they're doing full salary replacement. I think they're doing 6 weeks, and they're pretty inclusive in terms of who they make eligible for the program, and they're really trying to target moms who don't have other options and who certainly don't have paid leave options. And a huge problem that they ran into is that if moms took advantage of this for 6 weeks, then they would lose their TANF childcare benefit, right? And because they weren't actually working. And so really had to do a lot of legwork then to make sure that we didn't make these families worse off. Okay, you've got 6 weeks, but now you have the stress of finding childcare and not having childcare once you're ready to go back into the labor force. And another question that I think that we dealt with in terms of talking about that program, but as a society we need to consider too, what if, you know, the employers were worried that these mothers would take their time off and then not come back to work. But from a society perspective, is that a bad thing? If they take the time off and decide that that's where they need to focus their energy, but how do we make the employer whole, and how do we make sure that they want to participate in this as well? And that was actually one other theme I'll bring up from the interviews, is these women entrepreneurs, when they're thinking about paid leave and when they're thinking about policies that support, they don't know what to do for their employees. They're not sure how to best support the employees in their businesses. And so I think there's so much room to try to help provide guidance to employers of all sizes about how you might provide better support.
I'll just jump in and add on top of what Tami and Elise have already said, and reiterate that there's tons of research out there that shows that providing things like paid leave increase particularly women's attachment to the labor market. Women who have access to paid leave are more likely to return to work after giving birth to a new child. They're more likely to return to the same employer and have, more hours at that employer than women who don't have access to paid leave. And so that's a benefit to employers, right? Because they're able to attract and retain talent. They're not losing people due to turnover when they have these events like having children or having to take care of a sick family member, right? But I think there's two trends going on here. One, you have this sort of race to the top among, really large corporations who are trying to outdo each other with how much paid leave they can offer to their employees. But then you also have, small businesses who would really like to support their employees, but have a really hard time trying to figure out how to make that work in terms of budgeting. And so we're seeing a lot of really promising trends at the state level in terms of states who are offering or who have created paid family leave programs. I think there's 8 states now, in addition to the District of Columbia, who have programs on the books, but obviously these policies don't touch the vast majority of the American population. But what's great about these types of policies, they're all structured as social insurance models, right? Which means that instead of the employers paying the brunt of the cost of paying for that leave when parents are out or employees have to take care of sick family members, either employees or employers or both are contributing a small amount of the employee wages into this collective fund, which people who go off on leave are able to tap into when they need it. So it really lowers that cost for small businesses to be able to participate in those programs and be able to offer those sorts of supports to their employees. So I think that's another important consideration when we're thinking about how to structure a paid leave, sort of policy at the national level.
Yeah, I think you all raised some really, really good points, and I'm thinking, about how do we structure leave policies that are going to address a variety of circumstances, and thinking through how this might interact with other benefits that folks are receiving and other programs and policies that are in place. It's really, it's a complicated issue. So I appreciate you all raising all of these perspectives. We've got a question here. Do we know anything about how much women and men factor childcare into their labor market decisions? Are the considerations direct, like specifically related to making accommodations for childcare, or indirect, like once they've decided to seek a specific type of job or career, they consider the one that allows most flexibility with childcare? Does anybody want to take that one?
For me, those are some of the questions we don't completely know the answer to. We're not exactly sure the timing. I think we do have some data sets out there, and we're going to be working more with a national longitudinal study of youth to try to see if we can sort out some of these timing issues. But I suspect it's some of both. I suspect that there are people who make decisions about exactly what to do as an occupation because of their family situation, and others who go into an occupation and then have to make adjustments along the way. And I think COVID is a perfect example. We're probably all doing our jobs, or maybe doing them a little bit differently than we would have, and I know personally that means shifting some of it to the weekend when I can get a babysitter in and have them here for my children, and so moving things around. Yeah, I do not have a good answer. I think it's some of all of the above.
Yeah, and kind of like I was saying in my remarks earlier, like these are some things that we're definitely wondering, and we think that there might be some sort of relationship there, but as Tami was saying, it's probably a little bit of both. We have some data that shows that there is some connection there, but what direction or who came first, the chicken or the egg, is a little bit unclear at this point. I mean, we know that women are more likely to work part-time. We know that among those who are working part-time, women are way more likely to work part-time for caregiving or other family, care needs. And then, as I was mentioning before, we know that women are more likely to pursue entrepreneurship, at least in part, to get more work-life balance, to get those flexible working conditions. And so again, those might be a draw to entrepreneurship, and they might be a draw to certain occupations or types of jobs for women. But again, not a whole lot of good evidence out there as to whether that's the cause or the consequence there.
And there also is evidence when you think about, well, are women choosing between flexible work hours or higher pay, that men are actually getting both. Men often do have the higher pay. They also do have a lot of those other workplace benefits. So not only some of those monetary benefits, but also offer that flexibility. And so that trade-off is false in a lot of ways, because women often don't have access to those jobs. They don't necessarily have access to the promotions, right? So when a heterosexual couple has a kid, a man is seen as more committed to their job and maybe offered more opportunities, and a woman is often seen as less committed to her job and maybe offered fewer opportunities. And so the question of choice, I think, is false in some ways.
You brought up a really good point, Elise, and I want to piggyback off of that just a little bit, because you reminded me of other research that's out there that shows that even when they have access to these sorts of accommodations, women tend to be penalized when they, make use of them. So if they take that paid leave, they're out for a couple of weeks around the birth of a child, or they make use of those flexible working arrangements so they can better take care of their kids when they're at home. Women tend to be seen as less committed to their jobs. Whereas men seem to be, great father figures, and hooray, they're doing a good thing, right? So again, these sorts of things then feed into these lack of advancement opportunities for women who, even though they do have caregiving responsibilities, they are just as committed to their careers as men.
I think on the academic side, see some evidence consistent with that in the COVID world too. I mean, you see this with the stop the clock policies for tenure track, but also, so we're going to recognize that there are challenges related to COVID and childcare, and so we're going to allow you to pause your tenure clock, and often, and the women are mostly doing the care, and so they need that, and they need that pause, and they're going to have lower productivity because of that. But oftentimes the men are able to actually continue working and maybe be more productive, and so now you've solved one problem, but then you've kind of created another penalty in the system.
Yeah, it again speaks to those complications in terms of, creating policies that might seem as though they would be alleviating problems, and yet when you implement them, they are taken up in ways that are unexpected, sometimes with unintended consequences. Yeah. We've got a question here. Can you talk about how your work relates to the research on care work entrepreneurs, such as family child care providers who move towards starting these businesses for the reasons that you've stated? So I think the question is about women in particular who might be deciding to start businesses focused on childcare to kind of address some of these work, family, and time constraints, some of these issues that we've talked about, cost of childcare.
I haven't really done any work on like the specific decision to pursue entrepreneurship within the childcare field. But I think one of the important things to note in this area is that, one, women tend to be highly concentrated in this particular sector. The majority of childcare businesses are run by women. And I think Elise might have said something about this in her opening remarks, but these businesses also tend to have much lower revenues, going back to this fact that care work is so undervalued in the US. So, even if the business is open to help alleviate some of the caregiving responsibilities and help attain work-life balance for the owner, it's not necessarily providing the economic security that other types of self-employment might. So again, this is a huge area that really needs some work, and we really need to figure out ways and policies to, reframe our valuation of caregiving.
Interestingly, in the COVID space, there's a whole new opportunity maybe in this area. A lot of, because schools have been online, at least in my area for a while, there's a number of small businesses that are struggling that normally provide other services. So we'll say Taekwondo training or something, who are now opening up their studio for these kind of virtual learning opportunities or gathering places. And I think that probably is not as concentrated among women necessarily, just these small businesses that are struggling to, so it serves a purpose. Does it serve the best? But I don't know, because is that where these entrepreneurs want to be? And should we separate, entrepreneurship kind of out of necessity or making things work and providing just enough revenue from someone who's really pursuing their passions and really pursuing what they want to do in life? And I worry that we miss out on some of the innovative entrepreneurship. We miss out on some of the economic benefit of having people really do what it is that they're passionate about, partly because they don't have the supports on the social side.
Yeah, it's a really great point. I think we're all economists and we like to think about efficiency and people really having that freedom to pursue. And so I think that providing that caring infrastructure provides women particularly with the opportunities to pursue their passion, maybe the fields that they are best at, that will be best for themselves and perhaps for society. That has to include as well providing for those caring entrepreneurs. And we need that infrastructure to make sure that those are good paying jobs as well. So just seconding everything you both said.
Yeah. Well, we're wrapping up our first panel here shortly and turning to a roundtable. Before we do, I want to ask each of you, and you all have touched on this a bit throughout the discussion this morning, but I'm curious what you see as some of the biggest changes that you're seeing taking place during COVID. And in addition, what are some of the biggest priorities that you see moving forward as we think about coming out of this pandemic and an economic recovery? What are some of the pieces when we think about care infrastructure, we think about issues of gender equality, we think about providing opportunities for people? What should we be prioritizing and what should we be thinking about?
It's really dangerous to ask me a COVID related question because for the last 5 months, I have been the COVID data girl, running forecasts. And to me, some of the big questions are, we know that this has changed the structure. We know that it has placed caregiving demands and created a lot of stress on people who are trying to work and provide the care too. And unfortunately, I have to tell you, the models suggest no end in sight, right? Like, this is something we're going to have to manage for a long time. I think there's a lot of challenges between, and I think some voices maybe are not at the table. The public health voices have been at the table from the very beginning. Some of these other costs have not maybe been at the table. So when we talk about, do we have children in school or not, I think we have to get really serious about what the important questions are. Is it that we're afraid spread is happening in school? And if spread is happening in school, then maybe not being in school is, but if it's not, if there are mitigation measures, or what's the alternative? Even if kids aren't in school, they're in these other settings, which may or may not contribute to the spread. Are we worried about the spread of COVID? Are we worried about mortality? Are we worried about hospitalization? I think those are all different things. But to me, a big question coming out of this too is, I feel those stresses as someone who's working with the caregiving responsibilities, but I have had a job this entire time, and I have been able to work from home this entire time, and I have had leniency from my employer this entire time. And there are so many people out there who have not had that and don't have, you know, even just basic supports. And so I think as this stretches on, as this becomes 5 months and 6 months, and somebody from the beginning said 24 months, and you know, it's looking more and more like they might be spot on there. So as this continues to stretch on, you know, what is the fallout, and some of the broader costs and that we need to think about, and how we support people in terms of working and having opportunities, and also the social supports and the child care.
When we were looking at the job losses from COVID, obviously there's all the public health issues. We were looking at the job losses. They disproportionately fell on women. And that has to do with historical occupational segregation and where women work, particularly lower wage women, where they're working. Yes, there's obviously people who are able to continue working from home, maybe having to manage lots of different responsibilities at home and at work while being at home, but were able to keep their income source. But for millions of people, they were not able to. So policymakers stepped up right away, and they expanded the unemployment insurance system. What we need to do is we need to make some of those policies permanent, and that particularly affected some self-employed workers, also workers that had a sporadic job history or had lower wages. And so that was really important. That's one of the things we need to really think about, making that a federal program and making some of those expansions permanent. But particularly when we think about childcare or family care, there was an immediate provision there to provide paid sick leave, short-term sick leave and longer-term sick leave. And it was immediately apparent to policymakers that that was important in a pandemic. And we talk a lot about the difference between this and the flu season and what does that mean? Well, workers all the time, all year long, don't have those paid sick leave protections. So what's the first thing you do? You just make those permanent, right? Let's create federal policy. Let's close in all those huge loopholes that were in that program. And that's just a simple thing. We know that that was an important policy that affected many people. We need to increase the replacement rate so that people have enough wages to be able to actually take that leave, because we don't want kids going to school sick. We don't want parents or just working adults going to work and infecting their colleagues, infecting their customers. So those are just some really easy things that we should be thinking about.
Everything she just said, and then some, particularly around the paid leave piece, right? You know, policymakers did step up when the COVID pandemic hit, and again, you know, recognize that this was something that's really important now that we have this, you know, global health crisis. But I think the challenge moving forward in making these types of policies more permanent is figuring out the best way to structure those policies and programs. The way that it was structured in the emergency relief that was passed when COVID first hit was as sort of like a reimbursement to business owners who were providing paid leave to their employees. But I think the struggle here was that because all of these businesses were also, you know, hit really hard, their revenues were down, they weren't getting income coming in, many of them could not afford to wait for that reimbursement. It was like dire, right? So we definitely need to figure out ways to make these programs affordable, get access to these leave provisions for, you know, small businesses. I think I mentioned this earlier, you know, thinking about social insurance type programs where, you know, we have these funds already set aside that reduces the cost burden on small business owners, I think is one of the big ways to go. And as I was mentioning before, you know, COVID also, you know, really ramped up the caregiving burden for many folks. And we're finding from our own small business impact surveys that, you know, small business owners are really struggling making that adjustment to remote work. Their employees are struggling making that adjustment. You know, an extension of this is the caregiving implications that has. And so again, I think this really highlights all of the gaps in the caregiving infrastructure and really underscores the need for us to focus on ways that we can increase access to childcare, one, but then also make that childcare affordable and provide better wages for workers in this field so that we can boost the quality of that care as well.
Right, well, this is going to conclude our first panel. I want to extend really deep appreciation for each of you for all that you've shared this morning. So it's been really a great conversation and a lot of really important things to bring to light. So I appreciate you bringing your expertise and sharing with us all. I'd like to, at this time, introduce the moderator for our roundtable, Ms. Annie Rorem. She is currently the section head for Science and Technology at the Federal Research Division at the Library of Congress, and she will be introducing our roundtable.
Thank you, Jessica. Can I get a thumbs up if you can hear me? Yeah, excellent. Thank you so much for the opportunity to moderate this roundtable of very impressive and interesting folks. By way of introduction for myself, I am a researcher by trade. I previously worked for the National Women's Business Council at the Small Business Administration, and I'm happy to say that we have a current member of the council joining us for our roundtable discussion today. So the conversation is around approaches and interventions to support entrepreneurs with caregiving responsibilities. And I've encouraged our participants to share, obviously, their areas of expertise, whether they're research, professional, otherwise. But I've also made it clear that we should feel comfortable sharing some personal stories as well. And I'll say, you may hear some shrieking in the background on my end. My 1-year-old is in the room next door, and I think he's having a great time, but, you know, we might hear from him. So without further ado, I'm just going to give you the list of the roundtable participants. You see a list in front of you here. So I actually don't need to go over that again. I apologize. What I'll do first is introduce Dr. Elizabeth Cascio, who's the Associate Professor of Economics at Dartmouth College and a Research Associate at the National Bureau of Economic Research, to kick us off to talk a little bit about her background and her work in this area of caregiving and women's participation in the labor market.
Thanks so much, Annie. Yes, so I'm an academic economist, and one of my lines of research has been at the nexus of childcare and education, and how they affect all aspects of life, including labor markets. So my research really hasn't been specific to entrepreneurship. What I'm going to be giving is probably kind of a 30,000-foot view of how childcare and labor markets interact, and some thoughts on how the current policy environment and pandemic environment are shaping that interaction. So from a theoretical labor supply perspective, the higher the childcare costs are, the more those costs offset a primary caregivers, and I'm going to say mothers here just to make it shorter from here on out, realizing that fathers are also sometimes primary caregivers, but the more they offset earnings, and the greater the chance that it's just not economically sensible for a woman to work. So this leads economists, right, in theory, to this idea that if we could somehow lower childcare costs, or if childcare costs were just lower, more caregivers, more mothers would work, participation rates would rise. But I think that the reality is often that work is determined first, and then parents figure out how to fulfill those childcare needs. So in the US, we have very little in the way of government subsidies for childcare. And I'm just gonna pull up here, if I can, some slides that I'll just have in the background. Maybe I will do that. Hold on a moment. There we go. And this is just a table from a piece I did for the Hamilton Project in 2017. And you can just glance at this as I'm speaking now. I'm not going to go into the specifics of these programs, but you should just notice that the percentages at each age are pretty low that are served by each of these types of programs. And so because center-based care is so expensive, and you want to think for infant care, a high quality center-based program is going to rival the cost of in-state college tuition. You know, only high potential earners are going to be able to afford it without a subsidy. And, you know, as potential earnings fall, families are going to be more likely to turn to lower cost options, which might be, you know, non-relative care outside of the home, like a family daycare, care with relatives if they are close by, and so on. So, you know, one benefit of the private sector here is the diversity of needs can be met. You know, there are ways to meet childcare needs if you have an unusual or really demanding schedule. But, you know, of course, the downside is that there are really large gaps, especially by socioeconomic status, in access to center-based care. And, you know, part of that also is kind of, you know, a rural-urban divide as well. Like the density of options here matters too. So what I'm showing you here is a graph also from that same piece from 2017, showing you just by age of the child based on the October current population survey and by family income, kind of below $25,000 a year and above $75,000 a year, you know, what kids are doing, what kind of school they're enrolled in. And, you know, by the time that kids get to about 6 years old, the probability that a kid is in school, you know, at least during the school day, is pretty much the same across that distribution. But leading up to that point, there are large gaps by income in whether a child is in some sort of formal type program. And that's being driven by the fact that higher income people, and I'm not saying that $75,000 a year is high income, I'm saying that's what I can see in the data, that is, you know, they're more likely to afford those types of private options. So let's return to this idea just briefly about, you know, this idea that work is kind of determined first. So the current policy environment is really such that like the largest implicit subsidy for childcare comes whenever a child can start school. So we all know this, you know, if we have had children and we've been using center-based care, it feels so nice whenever we don't have to pay for it anymore. But the literature in these graphs that I'm showing you right here kind of show us that as childcare costs fall, whenever, say, your youngest child becomes school age, the employment rate of women really doesn't change very much at all, okay? So it's not as if a lot of women are just kind of sitting around waiting until their children can start school to enter the labor force. Subsidies at earlier ages do actually potentially, you know, matter, you know, through a program like the Child Care and Development Fund, but that program is actually really quite small. So this, and I'm just going to stop sharing my screen here for a moment. Those were the main slides that I wanted. Oh no, I have more I want to show you. I forgot. I'll keep this up here for the moment. I had 2 points. The current child care landscape is actually, you know, pre-pandemic is really quite challenging. And the subsidies that we do have are either coming too late or too small to really greatly impact labor supply. The other thing I wanted to sort of say here is that there are just, I think this was touched on in the earlier panel as well, there are really just substantial and persistent labor force participation reductions that come from motherhood. So I'm going to show you a few graphs, not ones that I produced, but from a paper by Henry Clevin and co-authors, looking at different countries. And so this is showing, just sort of graphically, I think this is very stunning, the long run penalty to employment after a first birth in both the US and the UK. So I could show something similar for earnings, and you would see the same type of phenomenon where after a first birth, the likelihood that a woman is employed or participates in the labor force, goes down, and it really doesn't ever recover. On the other hand, if we take the Scandinavian countries just by point of comparison, there's much less of a decline here. And so we know that the policy environments in Scandinavian countries, and I'm not just talking about childcare here, but also parental leave, that they're just sort of much more robust. So it's sort of tempting to conclude when you see something like this that, you know, these policy differences actually matter a great deal. And one of the things that these folks show in the paper is that policy is sort of a necessary but not necessarily sufficient condition to reduce this penalty, that countries where there are strong gender norms against women working, even if they have really pretty strong kind of policy environments, aren't ones where this motherhood penalty is going to be much lower. So we know that gender norms also vary quite a bit across the United States, just sort of something to keep in mind in terms of the policy environment. Finally, you know, the pandemic really has made things worse. And we were hearing about this in the first panel. There's really been, unless I missed it, no real robust targeted federal policy response for the private childcare sector where profit margins can be razor thin, or for public schools, which are struggling with downturns in state revenues, as well as kind of meeting the needs of the current teaching environment. What we've learned from the Census Bureau's household pulse survey is the number of hours that parents are spending with their children has been going up. It's gone up more for mothers, and the lack of childcare has been more of an impediment to women's participation as well. And so I'll leave us on a very dire note here. I saw a nice talk by Claudia Golden, who's pretty much the preeminent sort of historian, economic historian of women in the United States. And in this talk this summer, her fear is that if nothing is done here, if we don't get really creative, see some entrepreneurship here, women's career progress is going to be set back by generations. So something has to give. So I will stop there and stop sharing my screen as well.
Thank you so much, Dr. Cascio. Cheery. I think you bring up a really good point, though, about creativity and entrepreneurship. And let's move into that in our next part of the conversation with Mrs. Katie Hendrix, who is who's Chief of Staff at CoLab, and is going to talk to us a little bit about the challenges that entrepreneurs are facing, but also some ways that she's seeing them creatively surmount those challenges in her work. So Katie, the floor is yours.
Yeah, thank you so much. Good morning, everyone. It's funny kind of going right after your talk, Dr. Cascio, because I started my job at CoLab coming off of maternity leave for my first child. So my experience as a working mother in the entrepreneur world has very much been firsthand. So it's really interesting just to kind of think through everything that you said. But regarding CoLab, we have examined strategies for childcare among budding entrepreneurs for several years. And as part of our Kauffman grant, which ended in 2018, we provided childcare services for entrepreneurs in our Co-Starters program. We experimented with parallel programming for children and parents and traditional childcare. This was part of a broader programming to provide entrepreneurial education to underserved communities. And in that, we learned that 100% of the parent participants responded that childcare enabled them to participate. This opportunity also led for higher participation of female entrepreneurs, which we ended our 2018 programming with 54% of female participants, where we typically trend below 40%. And additionally, our partnership with La Paz, which is a nonprofit in Chattanooga, whose mission is to empower and engage Chattanooga's Latinx population. Our partnership with them really yielded strong success with Latinx business owners, where family businesses often involve both parents. And so having childcare allowed both parents to engage more deeply in our programming, which really was the first time that these families in this community were able to be involved in our programming. And we additionally had it in Spanish, which was a big deal, both childcare and as a Spanish teacher. So some of the takeaways from that program is that for women who are looking to take the first steps in business, having access to childcare really did reduce the barrier to entry for entrepreneurship education. And as I said, since I started the job at CoLab, I now have a 2.5-year-old, but at the very beginning, there was quite the juggle of, if I needed to do something like this, a panel in person, and my husband had to work, then who juggled the baby? And many times, graciously, I would speak to our co-starters programs on Capital. It still is, it's the 8th week of the program. And I would probably say out of previous, at least when we were in person, I mean, my son had to come with me after I picked him up from daycare just because of the juggling with my husband's schedule. And graciously, all the entrepreneurs were kind to a little toddler that was kind of in the way. But for me, even having had, if there had been childcare that night, I would have been able to give my son, been able to do my speech, and then be able to pick him up and go on. So interesting. So that's one of our takeaways, just having that childcare really added female participation. But also, here's the other piece where childcare is a value added service. It certainly doesn't remove all the anxiety related to childcare or allow entrepreneurs to dedicate their full attention to their business or that education at the moment. So meaning you might be in a classroom for 3 hours, but very aware that your child is in the next room, and something might happen where they might need you. And even just for me, when that instance, I had to go, pick up my child, knew he was coming with me, knew a little bit of stress. Did I have enough snacks? Was I prepared for whatever might happen in the midst of having him close by? But I did have the opportunity to speak, which was pretty amazing. So, and looking at COVID and some of the challenges with entrepreneurship there, much of our information has come from dozens of conversations with entrepreneurs in the Chattanooga region and other regions. So for many, being an entrepreneur has added flexibility to manage this disruptions in childcare and school. And additionally, some business owners that we work with have found ways to incorporate the working age children in their business, so they're able to work alongside their kids during the day. On the other side is caregiving, along with broader concerns and stress related to aging parents, has also become a theme. So some entrepreneurs have taken in aging parents due to the increased COVID risk in long-term care and senior facilities. So what does that look like to be both an entrepreneur, maybe have child-age kids and aging parents at the same time? So working from home policies really have created more flexibilities for caregivers, both for children and adults, to manage this volatility of the COVID schedule. Having that flexibility, having similar 4-day schedules is a blessing. So you see both the working from home and the entrepreneur and that blend of things. So looking forward, what opportunities there are out there, what would it look like to examine the financial impact of caregiving on cash-strapped entrepreneurs? So it gives us a few questions to think through. What are the incremental risk factors for entrepreneurs as their caregiving responsibilities increase? What are the risks to those that they care for? And then kind of going off the panel before, consider the opportunity of utilizing FMLA for startups and small business owners. And then lastly, what would it look like for a shared services caregiving model for entrepreneurial networks? So I'll leave you with those questions. Thank y'all so much.
Thank you, and I think that sets us up extremely well for Ms. Tiffany Frye, who is the co-founder of Nido in Durham, and who will be talking a little bit about her own experience as an entrepreneur who has founded an opportunity for entrepreneurs to have some caregiving available to them, kind of in a sense, a meta version of what you're just talking about. So thank you so much. Tiffany, please take it away.
Yeah, thank you for having me. Yeah, it sounds like there's a lot of overlap. Some of the things we were trying to do at Nido with what Katie was just talking about. So just to give you an overview, so Nido is a co-working space with on-site preschool, and it is an all inclusive model. So it wasn't a childcare component added to an existing co-working space, but it was really built up as a community for that explicit purpose of combining co-working and childcare. This was born out of necessity. So after my daughter was born, I was working from home for a company that was like over in the next town. So I was trying to just stay working from home, and it was great, but as you all know, also impossible. So I wondered if this sort of thing existed, and it didn't. And I was really surprised. Actually, at the time, there was only one co-working space that offered on-site childcare, and it was in California. In the United States, there were others in Europe at the time, but in the United States, there was only one, which is, I just thought that was wild, that this wasn't something that we had. So I kind of just became dead set on making it a thing that existed. So it started in my house, actually, this house that I'm in right now, but in a different couple of rooms. And then we ran a commercial location for 5 years. We have closed that space during COVID because we couldn't find a way to make it safe in an open plan co-working space. So we are actually exploring a partnership right now, and on the search for a new space, and we anticipate being back operational in 2021. So, but what I want to talk about, that's just kind of the basic, like the structure of NIDO, and people would often come for this concept of, oh, I've got a co-working space where I can work, and my children would be in the same building. But what we found was really the thing that made it special was kind of the self-determination for mostly female-identified caregivers to create a space that actually met their needs, rather than being in a male heteronormative space that was never meant for women, you know, if we're honest. And it doesn't work for a lot of women. And so NIDO became really kind of this experiment of what does it look like if we make a space that meets our needs. I will say we did have some men that were members, but I would say in general, it was about 85% women and non-binary members, and very small percentage men, and sometimes even lower percentage of men. And we adhered very strongly to this idea that the community should, like I said, just determine what the community was. So regular community meetings, regular opportunities for people to be involved in determining the direction of the space, and the kind of, I guess, allegiance, the loyalty, the real emotional investment that we saw come from that was huge. And I think it's really worth thinking about as we think about what does post-COVID look like. We need to be really cognizant of the people that are making those decisions and the people that are going to be creating those spaces. And unfortunately, as has been covered by the other two speakers so far, is that women are so stretched thin right now. How are we going to have the capacity to be in the position to create the new structures that we need post-COVID? So that's something that is on my mind constantly, as this feeling that not having the childcare, working remotely, all of these things, the effect they have is that women are so like worn down, I guess, that like it's hard to do the advocacy. It's hard to do that extra bit of work to make the world actually function better for us. So I don't have a solution to that, but that's just something that's kind of weighing on me right now. But yeah, I guess with NIDO, what we saw, the other thing I want to point out with NIDO is that it very closely tied to this creating your space is also creating new stories around entrepreneurship and what that looks like. So this kind of myth of the Silicon Valley entrepreneur or tech entrepreneur in general that works 80 hours a week, I mean, right there, you're like, okay, well, that person's not a caregiver. Like that is not possible for someone who has caregiving responsibilities. And so we have to create new stories. And that was something we built up a lot at NIDO, and also at another organization in town that we were partnering a lot with at the time, which was a women entrepreneurs collective. So building up these stories of what does entrepreneurship look like when one of your primary motives is to have flexibility and balance in your life. So, and autonomy to make the decisions you need to make for your family. Entrepreneurship for someone who has caregiving responsibilities is very different from someone who is trying to start a technology company that becomes their life's work for years and years. Like it's just a very different mindset, and it's not that women and caregivers can't do those things, but we also need to think about entrepreneurship more broadly, and think about business ownership and starting businesses more broadly, so that it brings women into those stories more, and so that we just have success stories that we can look to. So, you know, one of the examples, a lot of businesses were started at NIDO, which was so wonderful to see. A lot of women would come to this space, maybe they were still working their remote job, and this happened time and time again that they quit that job and they started a business, and it became successful. And then they opened their brick and mortar location, and they no longer needed to come to the co-working space. But that trajectory we saw over and over again. And I don't know that would happen without that modeling from your peers, like peers that are actually peers, like in the same situation. Because again, going to a co-working space that is male dominated, tech dominated, there's just not the alignment, and there's not like, you can't necessarily look to those people and say, oh, that's working for them, maybe it'll work for me. It's really important to be engaging with other entrepreneurs that have caregiving responsibilities to learn, what does that look like, and how do we create that new model, and then how do we create spaces that allow us to flourish as entrepreneurs, however we define that. So yeah, that's what I've got.
Thank you so much for sharing the experience of founding NIDO and some of the reasons why you structured it and continue to structure it in the way that you do. I'd like to turn it over to Ms. Jessica Flynn, who is an entrepreneur, the founder and CEO of Red Sky, who will perhaps offer some thoughts on some of the geographic considerations to childcare and entrepreneurship with respect to the rural versus more urban divide. So Ms. Flynn, the floor is yours.
Thank you. Appreciate the opportunity to join everyone. I'm joining from Boise, Idaho, and I am, as noted, CEO and founder of Red Sky. And we are a communication firm that's been female-owned, female-led, and majority employ women since 2008, the last time I feel that our economy was in a really interesting landscape. So through growing my business, I have had probably the majority of our employees being working parents, and that has been an interesting insight into the challenges that they face in moving ahead in their own pursuits. I am currently a member of the National Women's Business Council. And if you haven't heard of it, NWBC, yet another one of those federal acronyms, we are a nonpartisan federal advisory committee that's focused on providing advice and counsel to the president, Congress, and the head of the SBA on issues that affect women's business ownership and entrepreneurship. So our council has 3 areas of focus, and they are access to capital and opportunity, recognizing that one of the key things that holds women back from starting and growing a business is that access to capital and to funding. Also, women in STEM, recognizing that is one of the areas of rapid growth from a business standpoint and wanting to see more women represented there. And then my role, which is to head up the subcommittee on rural entrepreneurship. I would say people in my town of Boise, Idaho believe we're a thriving metropolitan, but we are rural when you look across the country and the different definitions of rurality. So within our council, the way that we look to develop policy recommendations that we pass on to policymakers on the Hill is to do a lot of what's happening here today, to share data, to share insights, to listen to the subject matter experts. And I will have to say, it is refreshing and wonderful that every single person speaking here today is a woman, because I frequently am involved in so many manels, and I really do appreciate the faces and the expertise that I'm getting to be part of today. So when we dive into some of this data, we look at what exists out there, and then we sometimes commission our own research. And so most recently, the council commissioned research looking at SBIR funding and grants. And several years ago, we looked at research related to millennial women in entrepreneurship, and last year, rural women's entrepreneurship. And I'm going to be referring to some of that data as we go through and I share some of our thoughts there. So I think everybody here has probably heard the data that was referenced earlier from the Amex report that women-owned businesses account for 42% of all small businesses, and that is about 13 million in our country, which is a great number. However, when you drill down a little bit more into that, we see that these women-owned businesses only account for 8% of the workforce and only 4.3% of the total business revenue. And when we look at why that could possibly be, a lot of it goes back to the fact that 90% of women-owned businesses, so 90% of that 13 million, those are non-employer businesses or solopreneurs. And so through our research, we're trying to understand what is it that is keeping women from growing and scaling their businesses and having a broader impact on the economy and in their communities. So when we did some of the research into the rural population, we did see that a significant portion of women were constrained by infrastructure issues. And so we were looking at research that was showing that, but then also the council hosts roundtables, and in 2020, virtual roundtables, where we go into communities and rural states and gather groups of women to help us kind of poke holes and understand the true experiences on the ground. And when we held roundtables in both Pella, Iowa and Boise, Idaho, we heard from these entrepreneurs that lack of infrastructure was a constraint. And what that was looking at was both infrastructure related to technology and connectivity and support for networking, and infrastructure related to childcare accessibility. From a standpoint of childcare deserts that exist in 51% of Americans live in a childcare desert, but 3 in 5 rural communities lack that adequate childcare supply. And a childcare desert is defined as either having no availability or 3 times as many kids that need childcare as there are open slots. The U.S. Chamber, I believe, coordinated a study in the early part of this year and last year that looked at these childcare deserts and how that was negatively affecting the economy. And so we heard from rural entrepreneurs that lack of childcare was constraining their ability to grow their business. Perhaps they were a necessity entrepreneur that started a home-based business because of that conflict between work and family. And they may be finding success there, but they don't have the ability to scale that because of the lack of childcare. In our research, we found out that rural women under the age of 30, some of these young women that really wanted to be starting and growing businesses, a significantly higher share of them that were entrepreneurs had children in the home than their non-entrepreneur fellow rural women. So 55% of young rural entrepreneurs had children in the home compared to about 38% of those who were not entrepreneurs. So they have that entrepreneurial drive. They've started something, but they lack the ability to scale it. So I can't get into all the details of the policy recommendations that we are developing and putting forward, because we'll be sharing those on September 29th in our public meeting, which is, I encourage all of you to join because this is a time for the public to add their thoughts and input into those recommendations. However, what we are really looking at is approaching the childcare question for rural entrepreneurs in 3 different ways. We want to use a 3-pronged approach to address, in the short and long term, childcare availability, reliability, and affordability. And our policy recommendations are going to hang upon that. And some of the overarching thoughts are, how can we look at and allow nonprofit childcare providers to receive small business aid? What are the ways that we can support that? Because in rural geographies, oftentimes these nonprofit childcare providers are the only available resources. How can we eliminate some barriers to provide childcare benefits? So eliminate barriers for employers to provide those childcare benefits. And then also, how can we encourage communities to incentivize investment in local childcare solutions? A lot of our roundtables have featured people that are being extremely innovative in their rural communities and combining both public, private, and nonprofit approaches so they can come up with a solution that is grounded in their community and recognizing that there are so many barriers to providing accessible childcare.
Thank you so much for sharing some of the priorities of the research that NWBC is currently doing, and looking forward to circling back around to some questions during the question and answer period. We've spent a lot of time to this moment talking about childcare, and while that's absolutely a critical part of the conversation, I think it's also important to look at other types of caregiving that entrepreneurs are doing. And fortunately for that, I'm excited to introduce Josephine Kalipeni, who is the Director of Policy and Federal Affairs at Caring Across Generations, to talk a little bit about her work in advocacy for caregiving, as the title says, across generations. So Josephine, the floor is yours.
Thank you so much. If you're able, give me a thumbs up if you can hear me. Great, wonderful. Thank you all for this opportunity, and I'm excited to be part of this conversation. Also, if I say something smart, you're welcome to tweet me at Malawian81 on Twitter. Sometimes the only way to prove you are actually where you said you were is if social media says you were. So feel free to do that thing. So I'm really excited to talk about all of the various topics that we're talking about here, and excited about the opportunity to also think about these issues in context of entrepreneurship, which is often not a space and conversation that I get to have. I'm tasked with adding the elder care responsibilities of caregiving into this conversation to really expand it out. At Caring Across Generations, we're really working to change the way that care is seen and valued and is solved for in this country, both in advocacy and research and doing various legislative campaigns, but also in culture change. I think there is a lot of different things that have to change about the posture of our culture when it comes to aging, care, caregiving, and a lot of other issues that I know people would nod their head on this particular call. You know, I think we're all, to some extent, really aware of what's happening around the demands of caregiving, particularly when we think about demographic changes. It's really interesting to me when I look at the fact that the under 4 years old population is growing at the same pace as the above 55 population. So when we look at the population curve, like we're having about 4 million children being born every year, that about, 4 million people are turning 65 every year. And when we think about those demographic changes, we have to center the idea of care and caregiving as it's contextualized in all of these issues. And then we also have to recognize that the infrastructure we're talking about was built in another time. mostly by white, very heteronormative, able men behind closed doors thinking about care and caregiving, and really on an assumption that no longer works. The idea that there's the luxury of having a stay-at-home parent who will handle all of the home duties while someone else is working outside the door to bring in all the bacon. Sorry, non-meat eaters. So it's just not the assumptions that we can make anymore. None of us are living in quite that reality anymore. Family compositions and dynamics are different. The reality of cost of living is different. The reality that you can find a job in the same area where your parents grew up and planted roots is just not real anymore. So parents are moving away from family communities that once would have stepped in to really help with family caregiving. The realities of family composition means that there's just so much more formal and informal caregiving supports that are required to just make everyday work. And the reality is on both ends, the math just doesn't add up. The money math doesn't add up when we think about cost of living demands and cost of caregiving with what people are making annually in pay and wages. And the time math doesn't add up. I am a single childless remote caregiver. And when I think about kids on top of that, a partner on top of that, anyone other than myself to think about on top of that, I just don't know how parents are managing work, let alone entrepreneurship, while caregiving, while figuring out how to make the ends work. So on none of the spectrums, the math doesn't add up. Then we have to think about what we often call sandwich generation caregivers, who are caregivers that are squeezed, or we say panini, between the care of two generations. Folks who are, sandwich generation caregivers are caring for someone under 18 and someone above 18, whether it's because of just the demands of care or because of age, ability, illness. The sandwich generation caregivers are then sandwiched between care of at least two different people whose care demands could vary wildly. So when we think about then centering sandwich generation caregivers, the demands just become so unmanageable, and the system doesn't work, the math doesn't work, and the numbers just don't work either. As if that wasn't enough, then the world gets turned upside down at the beginning of this year with a health crisis, a national and a global health crisis. And now those caregivers and all of us as caregivers have to think about caregiving in light of the coronavirus. There's a lot of conversation about, and not enough by any means, but there's conversation around the collapse of the childcare infrastructure. But we are seeing a parallel collapse on the elder care and disability infrastructure as well. So when we're thinking about childcare centers closing, adult daycare centers are also closing. So if you're a sandwich generation caregiver who relied on the minor existing infrastructure that was in place before the pandemic to assist with care on either ends of the spectrum, all of that is now completely gone, right? In a time where actually it doesn't mean that the bills stop or that work stops. It just means that any additional supports that caregivers might have cobbled together before to try to make any semblance of a 24-hour period work just no longer exists, and no longer existed overnight, right? There wasn't a transitional planning period where you think about your A, B, C, and D plan. It just sort of dissipated overnight. This is on top then of adding the risks of entrepreneurship, which I know many of us are familiar with. But when we think about desperate impacts of all of these things, of the wage gap, of cost of childcare, of cost of living, of access to childcare, and then we think about the fact that the fastest growing group of entrepreneurs is Black women in this country, and the risks of entrepreneurship, we are back recentering the most desperately impacted populations in our country across all of these issues. Not only that, but as primary caregivers, a lot of Black women are also the primary breadwinners in their families, which means the risk of entrepreneurship is even greater and is even further impacted by the current pandemic. So I just painted a really beautiful picture for all of us to sit with and hold and think about how we solve for. So at Caring Across, we've done a lot of thinking about what does this all mean, and what does this mean for the supports that family caregivers need. And we do a lot of talking with a lot of our fellows, a lot of our activists, and a lot of our base to really talk directly to family caregivers and ask these questions, ask directly impacted populations the questions of what would make a difference today, right now, and in a year, and in 5 years, and really shape our solutions based on what we're hearing, which I encourage all of us to do. If you're shaping solutions and thinking about solution in the comfort of your own four squares without ever talking to directly impacted populations, we're bound to get it wrong. So I really encourage all of us to do those hard conversations that sometimes don't move at the same pace of advocacy, policy, and research. And some of the things that we have found is that folks, at the end of the day, everything I'll talk about comes back to the financial resources we are pouring into our solutions. Folks are not looking for more programs, more ideas, more task forces, more research. At the end of the day, it comes down to how much money are we putting behind the solutions that we're talking about at every level of government, at programmatic levels, at the city level, at the state level, and at the federal level. We know that childcare is woefully underfunded. We know that programs to support entrepreneurs are woefully underfunded. We know that healthcare is woefully underfunded. So at the end of the day, we can talk about the tweaks, but if we're not talking about a major financial investment into the core care infrastructure of our country, we're just making small changes around the edges that don't actually impact the roots and the situation. So we talk to a lot of entrepreneurs, we talk to a lot of family caregivers who just say, if I had a little bit more flexible financial supports, I could actually do more. And we see a lot of programs that are well intended, but the requirements for the financial claims and spending behind a lot of those programs actually make it limiting. So if I have an 8-year-old and part of my caregiving is for that 8-year-old, but all of my city, state, and local programs only support financial supports for children under 5, I am still in the same situation that I was in a year ago and still taking the same risks and still being financially squeezed. The other thing that I will just say is we have to think about our care infrastructure, particularly home and community-based services, in a holistic way. It's not either child care or elder care. It's not whether or not people get paid leave or this other benefit. We have to think about the cohesive nature of how all of these programs work together. Families don't have the luxury of picking between childcare or elder care. When you're a sandwich generation caregiver, it's just not how siloed the issues and the options are. And we have to think about these issues in a more holistic and connected way. The other thing that I know is when we've talked to a lot of family caregivers actually who are entrepreneurs, whether it's because they've started a child care center or a network in their locale, or because they are a contractor or a consultant elsewhere. And a lot of times they tell us the challenges of being both the founder, the worker, the public face, the recruiter, the HR department. And we talk to a lot of entrepreneurs who say things like licensing and business maintenance support is actually what's making it hard for me to continue doing the work that I'm doing. So in addition to caregiving on both ends of the spectrum, then I have to think about where my licensing sits at the city and state level. And I have to be the one that knows when to renew it. I have to be the one doing the bookkeeping. And in addition to that, I think the other challenge that we hear is there aren't enough coaching networks that look like Black women. And because oftentimes the support because oftentimes we tend to identify with people who look like us as a place that feels safe for asking questions and seeking support. That lack of existing coaching infrastructure and network just makes it that much harder to push beyond the double combination of being an entrepreneur and a sandwich caregiver or just an unpaid family caregiver. So I think we have to think about how all of those issues work in tandem and how we create a flexible care infrastructure that allows people to seamlessly flow in between supports and structures without creating benefits cliffs. That means one gain up here means a complete loss on this other end, in a way that also becomes detrimental and destabilizing for families. And lastly, before we move on, I will just say what I started this whole soapbox spiel with, is that I truly believe that the people closest to the problems are closest to the solutions. They already know what's needed to make it work. And if we're not tapping into that, we're actually going to lose really creative solutions that help connect dots across people's experiences and really solve for what people need.
Thank you so much for sharing your perspective and your energy too. That was a very, I don't know, I want to point out to everybody the Q&A feature here where Anna wrote amen while you were speaking. So first of all, amen. And second of all, use that Q&A feature. If you're attending and you have questions for any of our panelists, we're going to be wrapping up after our next and final panelists, but please do put your questions in that Q&A box. So on to our final panelists. Pleased to introduce Ms. Gina Adams, who's a senior fellow at the Urban Institute and who's going to take on the task of, in a sense, putting a little bit of a bow on a lot of the things we've talked about today, not to put too much pressure on you, Ms. Adams. The floor is yours.
Thank you so much. Can you all hear me okay? Yes? Okay. So thanks so much for inviting me to be part of this today. I can't put a bow on this. I'm sorry, I will try. But I want to make a few quick points just to contribute to the conversation. One is, I think that it's really important to recognize, my specialty is much more on the childcare side, that the childcare system really is not a system. It's mostly a private market of individuals and small businesses providing childcare that the federal government and state governments provide a little bit of money to some families to help them purchase that. It's not a system. And it's very labor intensive. Good quality care costs more because the primary people paying for this are parents, and they are paying a lot, but they cannot pay what it costs to provide good quality care, which keeps the quality of care lower overall. Obviously, this is a little different in higher income communities where people can afford these things, but it means that we have generally low quality care, very underpaid staff, which we've heard about, and shortages, the childcare deserts that folks have talked about earlier. So the challenge that we face right now is that it already was very fragile, and the pandemic has put massive pressure on what already had a lot of cracks in the foundation, and honestly, it's kind of just broken it apart. The pandemic has, I think, revealed the central importance of childcare to our economy and our functioning. I've never heard the business community talk more about childcare as you hear about recently. And I think it might be an opportunity for us to really start reframing childcare as a public good rather than a private matter, which is really how it's been seen in the past. And I think the role of the entrepreneurial community and the business community in helping shape that narrative could be very powerful, because it really is all of our problem. It's not just the issue facing with parents who have young children or children school age. So let's talk a little bit about some of the policy issues. I just want to piggyback on what Josephine just said, which is, this is hard to say given that obviously we're facing a massive budget crisis in this country at every level. I mean, the federal government's putting a lot of money into things that the debt's rising. We all know the challenges, right? Local communities, states. But this is not a problem that can be fixed without money. The problem is parents are paying what they can. They cannot pay anymore, and there is no place else to go other than the business community or the public sector. Business community has a lot of other issues, and we can talk more in the discussion about what their role would be, but the public sector, this really is a public responsibility in my opinion. The funds that we have available serve only, as we heard earlier in the previous panel, a very small fraction of the people who are eligible for them. They tend to prioritize folks who are working, and very little is available for people who need to find a job, which is going to be really important in the coming months. Very little is available for people who need education and training, as somebody talked about, Jessica talked about earlier as well. Middle income families get a little bit of help, but it's really mostly through the tax system, and it's not paid, it's not enough, and it's not paid in a way that really helps them. The pandemic has created some massive challenges. Programs have closed, hard to reopen. Cost of providing care is much higher, PPE is higher, group sizes are smaller. Parents are shifting their kinds of care that they're interested in. School-age programs suddenly have to figure out how you're providing full day care and managing kids' remote learning, which is an issue we've not talked enough about in this country, in my opinion. Staff are very concerned about exposure, just like teachers. And so it's on top of that, all on top of the childcare deserts that we just heard about, right? So we're very concerned that without additional investments right now, we're going to lose, that supply is not going to come back. And when you think about the implications we've heard about earlier in these conversations about what happens if you don't have access to childcare in terms of the ability to start businesses, to work, to, leaving aside mental health issues and stress, it's really quite dire and quite frightening for those of us who have been working in this field for a long time. And I just want to say one thing. I've been a little alarmed at how the narrative, the public narrative, is much more about parents who can remote work than the many parents who actually have to go to work every day. There's very little conversation. We hear a lot about how hard it is to remote work and take care of your children at the same time, which I completely believe. But I cannot imagine what's going on for the families who actually have to go to work every day and have to figure out what to do with their children. Two other quick points. I know I'm at time. I'm going somehow fast as I can, but already hit my time. One is we have to make sure that the system is reflecting workers' realities. Right now, the majority of our public funds go to childcare centers, which are incredibly important, but are not available for families who don't work 9 to 5, which is increasingly the majority of families in this country. We have to figure out ways of supporting home-based providers, friends and relatives, figure out how to keep kids safe in those settings, but make sure that people, I can't remember who, Katie, I think you're talking about the evening care. A lot of people work at night. A lot of people have schedules that change every week, which creates havoc for childcare. We must start recognizing that our system has to reflect the realities that families face and not try to pigeonhole everybody into a 9 to 5 job, which is not the reality of the world anymore. The last point I want to make quickly piggybacks on what Josephine said as well, which is everything we do, to my mind, must be targeted on the folks who are facing the greatest risks right now. Put yourself in the place of somebody who has to go to work, who has a child with asthma and has their mother living with them, and has to figure out how do you balance your family's health needs, your child's learning needs, and your need to pay them, bring in the money to pay for their housing so that they don't get evicted. We should not be having parents having to make that level of desperate trade-offs, as I think Josephine's desperate impacts are truly frightening. And we must figure out ways of lowering those costs for people and recognizing that we need to help them make the choices that they feel are the best for their families in this context, which means a range of childcare arrangements, means supporting things like elder care, it means all of these infrastructure issues that we talked about. So I will wrap up there and turn it back to you, Annie.
Thank you so much. And I think you did a lovely job putting a little bit of a bow on what refuses to be neatly packaged up. I think that that's probably more my job as moderator, and I don't know that I can do any better. I can't improve on what you've already done so well. I will say, though, that I think the common theme that I'm hearing from all of our participants today is, I would say, twofold. If we looked in, say, the rearview mirror 7 months, and we're looking at February 2020, at that time, we could probably say the infrastructure for caregiving is outdated, as Josephine said. One of the effects of the current health crisis is that things that were at one time outdated have only become more rapidly outdated because so many things have changed since March of 2020. So we're looking at an outdated infrastructure for caregiving, and there are many reasons for that. As you point out, Ms. Adams, it's not a system. it's a disparate array of providers who may not be able to meet the needs of workers and entrepreneurs as they actually exist. And we have some real challenges in solving those problems. So we're really only 5 minutes away from time right now. I do want to remind folks that the Q&A box is available to you as an attendee, but I've gotten a question from the next moderator, who I will be introducing shortly, and I'd like to pose that question to the panelists. The question is, what about the involvement of men in the search for a solution? What can we do to support households as they negotiate the household division of labor? So I'm going to ask if anybody would like to start by responding to that. If nobody does, then I will pick somebody to put on the hot seat. I think all of you can probably offer some very smart responses to that. But if there's anybody chomping at the bit, I ask you to please unmute yourself and jump right on in. What's the involvement of men in the search for a solution, and what can we do to support households as they negotiate the household division of labor, especially in caregiving?
I can just do a very quick answer, and I hope other people chip in because it's not my area of expertise. But what I would say is we make resources available. People are making these choices because there's inadequate resources. If you funded childcare, then women would be able to go to work. We know that that happens. That's not sufficient. There's obviously cultural norms that we have, but we do know that when resources are available, women enter the workforce, and unfortunately when they're not available, they end up staying out, and that's the cultural norm. So I can't figure out how to change cultural norms, but I do know that making resources available would help.
Would anybody else like to add to that, especially thinking about the role of men in supporting caregiving among entrepreneurs specifically? I'll ask a question.
You know, I think there's a, yeah. Sure, just a thought. You know, we do, at Caring Across, we do a lot of culture change work, and we've been asking this very question about what is the role of men in really impacting our cultural posture around the value of women's work. And there's the feminist part of me that just cringes to even have to think about it, but there is the base and power building part of me that thinks about the various value of really engaging male voices in a couple of different ways. We have often also tried to tell the story of male caregivers, because I think sometimes having a solely genderized narrative in a culture that wants to dismiss the value of the work of women, when men say, damn, this is hard, it actually hits a different nerve in different circles, right? I think about the Zoom sort of video that went viral when it was like a man working and his kids busted in the room, and you know, it was like, that went more viral than any really great videos that I've seen that center women. And the reality, so I think there is just a role that we have to continue to think about and continue to organize around and experiment and see where it gets us. The other thing that I just want to add is that we, in addition to doing storytelling, we also think about other areas that could essentially set a precedent. We've seen this happen in really important ways around paid family and medical leave, where there is both a legislative and organizing strategy, but also a strategy that's looking at what is the role of employers, and are there large employers that help add to a national discourse. So one of the things we've sort of experimented with is thinking about where are there male-dominated spaces that could both have a caregiving conversation, but also institute instituting private solutions could help in the continuing and ongoing work. So for example, we've had conversations with the NFL, NBA, and with the baseball leagues. We know that athletes experience such wear and tear throughout their careers that they will need care, but also have spouses that are trying to figure out ongoing care and caregiving narratives, and are also employers of nannies and domestic workers and various caregivers, and are supporting aging parents. And so we've tried to really think about what are both like solutions they can put in their union contracts around care and caregiving supports, and what are the conversations that can happen from an inside out way that helps to shift the culture perspective. So I think there's ways to experiment with it, and there's ways to really think about various power dynamics and how that helps us win. So unlike my natural default of being like, I don't want to think about it or engage, I do think that there are some power mapping that actually helps us advance and make progress.
Thank you so much, Josephine. I will say that we are at time, and so I am going to make the transition to the next panel, and specifically to Dr. Amanda Elam, the next moderator. But I will note that one question we did not get to in this roundtable that may be appropriate for the next panel is about regulatory barriers. So specifically, regulatory obstacles that in-home providers and childcare centers face. And so I want to just frame that question for, unfortunately, the next panel to respond to as opposed to this current roundtable. I also want to thank the participants in this roundtable. I found this a very important discussion, not necessarily uplifting, although it is energizing and inspiring to think about the ways in which entrepreneurship may be poised to make some creative changes to the outdated system right now. I'm going to welcome Dr. Amanda Elam to take the proverbial floor. She's a research fellow at Diana International Institute at Babson College. Dr. Elam, please take it away. Thank you all.
Thank you so much. So hello, everyone, and welcome to our second panel. The topic is comparative perspective, what's being done in other countries to support entrepreneurs with caregiving responsibilities. As we transition away from sort of a US-centric discussion around this, I'll just make a note that based on my research studying gender and entrepreneurship around the world, that the systems, the infrastructure in different countries can be very different. There are some countries like in Scandinavia where they have very well-developed infrastructure for supporting family care needs. And then in a lot of developing countries, not only do they lack infrastructure, but they actually lack public budgets to help build that infrastructure. And so kind of on that note, I will introduce we have three speakers in this panel, and I'll introduce our first one. Irene, is it Boeckmann, Assistant Professor, University of Toronto?
Yes, thank you.
Great.
So I'm going to try to share my screen here with you all. Hang on. There we go. So today I'm going to talk a little bit about what other people have already touched upon, work-family policies from a cross-national perspective, and in particular how they can mitigate some of the impacts of what it means to have children and be engaged in the labor market. So let me advance my slide here. So first, I just wanted to give you sort of an idea of how having children matters differently for the labor market outcomes, in particular here, employment participation of different groups. So we know that in general, children affect dads or fathers less so in terms of their employment participation, work hours, and also their earnings than mothers. And here in this graph, I'm just showing you sort of the variation among OECD countries the differences in employment participation between different groups. So the light gray bars represent the difference in employment participation rates between childless men and dads. The dark gray bars, childless women and dads, and the red bars are probably the most interesting for us today, are the differences in employment participation rates between mothers and fathers. So we see that there's a wide range of how much parenthood and gender shapes employment participation across these countries. And in my research, and many other researchers are interested in this question, to examine what are possible influences of public policies. How do they shape the labor market outcomes of parents, namely of mothers? So again, I also want to acknowledge, like the previous speaker did, that of course, men face work-family issues, but we know also that, as this graph shows, that children affect moms currently in a much more impactful way. So government support families in various ways across these. I'm focusing here mainly on OECD countries, mainly in North America and in Europe. So governments in these countries support families in various ways. So financial transfers like family allowances, for example, or in-kind support. Many of you probably have heard of, for example, the baby box that new parents get in Finland. There are labor market protection rules that protect, for example, pregnant women from discrimination in the labor market. What I'm going to focus on today is policies that ensure that parents have time to care, so parental leave, maternity leave policies, and supporting non-parental care in the form of publicly funded childcare. So just to give you sort of an idea of the variation across countries, so usually we distinguish between birth-related leave that is often taken around the time of birth, or sometimes adoptive parents are also eligible to take some of this leave, but not in all countries. So for example, in the UK, new mothers and fathers are entitled, or fathers are entitled to a portion of this leave, 39 weeks at 30% of wage replacement. For example, in Canada, where I work, new mothers are entitled to 16 weeks at 50% wage replacement. And then we have these longer parental leaves that can be really long. So for example, in Finland, parents are entitled to around 140 weeks at about 20% of wage replacement. In Germany, 44 weeks. And in Canada, 35 weeks. So it's important to, even though this is sort of what gets talked about most often, sort of the length of leave and how much parents, what the parental leave benefits are, it's important to remember that there are a lot of eligibility requirements that I think we should talk more about. So in a lot of countries, self-employed are either excluded from these benefits, or they have to register and pay for special insurance programs. So for example, in Canada, self-employed or business owners can register for employment insurance, and they're entitled to similar benefits as workers in dependent employment. However, there are also eligibility requirements as for workers in dependent employment, but they're somewhat more stringent. So for example, small business owners, self-employed workers have to be registered with the employment insurance for at least 12 months, and they have to have currently have earned more than 7,000 Canadian dollars in 2019 to receive these earnings. And when we think about sort of what one of the most common occupation of self-employed women is childcare, as many of you touched upon already, we can see that maybe more precariously employed workers might not meet these eligibility requirements. So it's really important to sort of dig into the details of the design of these policies. So what have we found in terms of how leave policies shape or are related to labor market inequalities. So we found consistently, not just sort of the research group I was part of, but also other researchers have found this, that well-paid leaves of moderate length. So there's a bit of a debate what moderate length means. So I would say something around a year. Others have argued it's a bit longer, a little bit shorter, that kind of sweet spot. That is associated with a smaller impact of motherhood on employment, work hours, and earnings. But very long and unpaid leave, so longer than a year, 2 years, is associated with greater inequalities between mothers and childless women, for example. So very long leaves might incentivize employers to treat women and mothers in particular differently. So they might allocate them to jobs with shorter occupational ladders or part-time work, and it might also weaken women's labor market attachment. But we also found that no paid leaves are worse than having no paid leave. Access to no paid leave is worse than being entitled to long leave. So I'm out of time here. So I just wanted to skip to my conclusions here. Oops. So the implications of our research is essentially that we need to look at the specifics of the policy design, so eligibility requirements. And we also need to pay attention to coordination with different policy areas. So how well do leave policies jive with the availability of childcare? So if we have well-paid leave, but after the end of the leave, there's no childcare available or affordable childcare available, that might still have a detrimental effect on maternal employment. What I would also say in terms of advocating for public policies versus employer-based policies is that public policies don't go away when the CEO changes, for example. And in terms of entrepreneurs, public policies might also widen the access to these leave benefits, for example. So that's my part, and I'm happy to talk more about other types of policies in the Q&A.
Great. So thank you so much, Irene. Really appreciate that insight. I think that's exactly the kind of tactical data that we need to move this discussion forward. Next up, we have Mara Bolis. She's Associate Director, Women's Economic Rights, Gender, Justice, and Inclusion Hub at Oxfam America. Welcome, Mara.
Hi, thank you. I have so much that I want to share with you today that I'm going to try to speak very quickly and incomprehensibly in order to get it all jammed in there. I'm going to share my screen. So let's see. Okay, great. So at Oxfam, we have focused on the role of care in contributing to global inequality. We've been focusing on this issue for a number of years over the past, since coronavirus struck, really looking at the role of coronavirus in exacerbating these inequalities through disproportionate unpaid care work falling on the shoulders of women. And what that looks like internationally. So my talk today is going to be looking first at those conditions from a global perspective, what the ramifications of that unequal unpaid care burden is for women's livelihoods in different locations. And then finally, as we reinvent our economies, to provide some examples of policy efforts from around the world that can support people and entrepreneurs' caregiving responsibilities and their while they pursue their livelihoods activities. So earlier this year, in what was a crazy time of my life personally, it was we collected research between May and June when all of us were mostly still under lockdown. In Kenya, the Philippines, Great Britain, the USA, and Canada, to look at how lockdown conditions were affecting women and men's unpaid care work. And we also gathered some data in Tunisia. And what we found was that coronavirus was magnifying existing inequalities in terms of unpaid care. Across all the countries, women reported doing more care work than men. This graph shows the percentage of women in each one of these countries that felt that their care work has increased. As research, other research has shown, men did report doing more care work, but the care work load was so the care work increase load per household was so immense that increase in men's participation didn't offset the fact that women were still and are still and were still doing more, if that makes sense. I meant to say the inequalities that exist exist both within families, within countries and between countries. What that looks like within the US is racial minority families in the US and Canada spent more time on unpaid care and domestic work than white families. For instance, the single parents in the Philippines stated that on average they were experiencing 5 additional hours of unpaid care work a day under coronavirus lockdown conditions. In Kenya, water scarcity increased dramatically under lockdown conditions, also because of climate change and various other climatic events, that only 25% of respondents said that they had access to adequate water, down from 50% when this research had been done pre-coronavirus, which of course increases the time women and girls spend on water collection. And homeschooling and childminding took more of women's time in Tunisia, Kenya, and the Philippines than in the US and Canada, where it's been widely reported the effects of homeschooling and kids being at home on livelihood conditions actually were the lucky ones, which I'm sure many of us can imagine, although not evenly lucky, as I've noted. So ramifications in terms of livelihoods. So before the pandemic hit, 42% of working age women were unable to do paid work because of caregiving versus 6% of men. Yeah, so that's our baseline going into this. Economic dislocations due to the pandemic were evident across the board, right? So for a variety of reasons. As specific to care, we did find that caregiving increases did reduce the time that people are spending on livelihoods activities for both women and men. The severity is variable, right? In Kenya, 50%, where we were working in informal communities in Kenya, 50% of men and women said that their care work had compromised their paid work. In Tunisia, where before the pandemic, women were doing 8 hours of care work versus 45 minutes a day that men were doing of care work, women entrepreneurs interviewed said that their paid work had ceased completely, and that they didn't expect to be able to return to their income generating activities because there weren't sufficient social supports. And in US and Canada, minority respondents were more likely to have given up paid work than white respondents. But this is bleak, but we can decide to change. We can decide to change things. We can decide to change our priorities. And this is the choice that we have now, whether or not we choose to rebuild on the basis of austerity measures that cut social safety nets and undermine support for caregivers, or do we push our policymakers to reinvent? our economies, and center around what matters most, which is the well-being of everyone as affected through the right to care and the right to be cared for. So we at Oxfam are just at the beginning of a new effort to analyze and compare different countries' policy responses and policy approaches, packages with respect to caregiving. This is our framework that we're following, which is still under development. And I think it helps to organize some of the stuff that we've been talking about, that policy measures can fall into these different buckets, but care supporting infrastructure, care services, social protection for caregivers, family-friendly working arrangements, and programs that challenge traditional gender norms. I'm going to provide a few examples of each and hopefully not run out of time while I'm doing so. In terms of specific policy measures that have been undertaken in different parts of the world. So in terms of care supporting infrastructure, we're talking about things like how to reduce time spent on water collection, providing sanitation, access to transportation. So for example, in rural electrification projects in South Africa have been linked to the decrease in women's care work and a 9% increase in female time spent on livelihoods activities. In Vienna, efforts to gender mainstream urban planning has produced changes in infrastructure and housing that supports people's caregiving responsibilities. On the care services front, which includes everything that we've been talking about today, in Ethiopia, as part of the Productive Safety Net program, the government has created public works jobs that provide free childcare so that both women are able to pursue their livelihoods and income generating activities. And this effort itself has had a positive impact on men's appreciation of the value of caregiving. Social protection benefits related to care include benefits such as conditional cash transfers for those undertaking care-related responsibilities. In Argentina, the Universal Family Allowance per Child for Social Protection policy provides a monthly family allowance for parents who are unemployed or work in the informal economy. As we know, the predominance of women in Argentina are actually informal workers and often entrepreneurs of necessity. Family-friendly work arrangements, we've heard a lot about this today, particularly in the US, paid leave, flex time, anti-harassment discrimination policies. This isn't a policy measure, but an evidence for policymakers on the topic, is that research in the US has shown that a lack of family-friendly work arrangements, particularly for low-income workers, such as constantly fluctuating work hours and lack of any paid time off, adversely affects children's well-being. And programs that challenge gender norms. The effectiveness of these measures, all of these measures, as we've heard earlier today, depends on the attitudes surrounding the changes themselves. There was a question asked earlier about what the role of men is. A survey conducted by Promundo showed that 1 in 5 men were afraid of taking advantage of the paternity leave that had been afforded to them for fear of being penalized in the workplace. Governments, workplaces, employers, the NFL, the NBA, people need to be messaging that care work is a public good and that taking the time benefits our communities and our societies. And there are social norms programs, such as what was mentioned, that are being tested now that could be really effective. So I want to just stop by saying care is a right and a catalyst for economic vibrancy in our communities. So we can decide, as we not rebuild, but reinvent our economic system in the US, to center ourselves around the principle of care, as they've done in a whole of government approach in Uruguay, where the national care system is a multi-agency effort that goes to really elevate the fact that care is a right and a social function that involves the promotion of personal autonomy and assistance to people in need of dependency. We can do it. Thank you.
Excellent. Thank you so much, Mara. I really appreciate your highlighting the importance of mainstreaming care work, that it's a problem for everyone and it's a right. So I, again, thank you. And now we're going on to our final speaker in this panel, Dr. Vartuhi Tonoyan. She's assistant professor at the Department of Management, Larry and Patti Johanson Research Fellow at the Craig School of Business, California State University, Fresno. Vartuhi?
Yes, Amanda, thank you so much for the nice introduction. Good to see you, and thank you, Jessica, for inviting me. So I'm going to share my screen with you guys. Can you hear me well? Yeah, good, awesome. Perfect, awesome, great. So I'm going to change the focus of your attention, and I will be speaking about a different kind of institution that influences gender inequality in entrepreneurship, and that institution is called gender segregation in the labor market. So it is a persistent institution that cuts across the globe, and we're going to, first of all, learn what that is. I'm going to talk about the 3 types of sex segregation into traditional or dependent employment. Then I will be saying a few words about the first order effects of sex segregation on women's career in the dependent employment. After that, I am going to change the focus of the discussion and link the traditional sex segregation literature with the women's entrepreneurship literature or entrepreneurship literature in general. More specifically, I'm going to feature some of my latest results on the second order effects of sex segregation on gender inequality in entrepreneurship. And finally, time permitting, I would like to discuss a few policy implications or just throw out there, and then we can discuss them all together. Alrighty, so sex segregation in the dependent employment, as already mentioned, is a persistent and pervasive and very consequential labor market institution across the globe. So this slide is showing you the distribution of women and men employees across 22 European countries. And what you can see here is that most of the female employees would have to change between 50 to 70% of female employees would need to change their occupation so that we would have a gender parity in the labor market. So what is sex segregation? Sex segregation describes the tendency for men and women to be unevenly distributed across hierarchical levels, occupations, and entire industry sectors. So we have the vertical, horizontal, and industrial sex segregation. The vertical segregation describes the tendency for men to dominate the higher positions within an organization or occupation as such, where both men and women work. The horizontal sex segregation describes the tendency for men and women to be employed in different occupations. And the industrial sex segregation describes the tendency for men and women to be employed in different industry sectors. For example, public sector is a domain, female domain, across most countries in the world. So an interesting thing about this labor market institution, especially regarding the female-typed occupations, is that, well, such occupations include clerical, sales, care, and service activities, right, in the dependent employment. And they are largely consistent with abilities and characteristics attributed to women in a society. Now, with all that said, and as already mentioned, sex segregation is consequential, right? It is persistent because it persists, it's still there, despite increases in women's educational attainment around the world, despite increases in women's participation in the workforce. It is pervasive because it cuts across Western and Eastern hemispheres, it cuts across cultures, and it is a persistent phenomenon in both developed and developing countries around the world. Now, most importantly, sex segregation is consequential because it devalues status and prestige of female-dominated occupations, and it negatively impacts women's earnings in the dependent employment. Guys, can you hear me? Can you still hear me? Hello? Hello?
Yes,
Oh,
we can still hear you and see you. It's all
okay.
good.
Okay, thank you. Thank you so much, Amanda. So far I've been talking about the impact of sex-segregated labor market practices on women's career and career opportunities and earnings in the dependent employment. Next, I will be shifting your focus to entrepreneurship, and I will be connecting sex segregation in the dependent employment with gender inequality in entrepreneurship, which is the topic of my research. So it turns out that sex segregation is also consequential for entrepreneurship, because the majority of entrepreneurs start new businesses after having worked at least some amount of time in traditional employment. And so our research, my research that I have done in collaboration with awesome scholars such as Jennifer Jennings from the University of Alberta in Canada, Robert Strohmeyer from the University of Mannheim in Germany. So our research shows in a nutshell that sex segregation in traditional employment or the dependent employment negatively impacts women's startup ease perceptions, their actual transition to entrepreneurship, and their likelihood of innovating in an entrepreneurial role. So, for example, this slide shows you the results from our findings. Two papers are featured on this slide. So, taking a look at the first paper, so you can see that we have looked at startup ease perceptions of individuals working in different kinds of occupations, female type, gender integrated, and male type occupations. And especially or specifically, we have looked at the gender differences in the startup ease perceptions, which we measured with the survey question like this: how difficult or easy would it be for you to start your own business if you wanted to? So the data is big. We have analyzed approximately 15,742 employees across 22 European countries. And what we found is that, well, as expected, if employees in female-dominated occupations and industries have lower startup ease perceptions in comparison to their counterparts working in gender-integrated occupations and industries and male-dominated occupations and industries. And at the country level, regarding cross-country differences, we could establish that gender gaps in perceived startup ease prevail, and such gender gaps tend to be higher in countries with more highly sex-segregated labor market regimes. In the same paper, we have used panel data to analyze the transition of women employees from gender stereotypical occupations to entrepreneurship. And we could establish also, again, big data comprising 25 European countries, EU Silk panel data. We have analyzed approximately 500,000 employees across these countries, 25 European countries. And our finding is that, well, employees in female-dominated occupations are significantly less likely to transition to entrepreneurship, to establish new businesses, in comparison to those who work in either gender-segregated or male-dominated occupations. And finally, another result from our research is that, well, surprisingly, sex segregation has also consequences, negative, unintended, second-order consequences for female-male gaps in innovation in entrepreneurship. Because our research has shown that, well, for example, research based on German data, that unfortunately women entrepreneurs tend to innovate less in breadth and depth. And one of the causes of the female-male innovation gap is that women entrepreneurs tend to have lower skill diversity. That, in turn, is attributable to the lower likelihood of women entrepreneurs to possess managerial experience, which is a phenomenon that I've just described that is referred to as vertical sex segregation. Now, having said all that, so what kind of policy implications can we derive from our research? Well, our focus regarding making policy implications is on how to integrate gender markets, right? How to get them more integrated instead of having highly segregated gender markets, both in the traditional or dependent employment and entrepreneurship. Well, we concur with the body of existing research, such as Marianne Bertrand from Chicago Booth School of Business, and Esther Duflo from the Massachusetts Institute of Technology. These are, high flyers researchers who are conducting very good, rigorous research. We concur with their conclusions that government should set explicit quotas for increasing female representation in leadership roles in both private companies and public sector organizations. Why would that be important? Well, because establishing a critical mass of women in leadership positions is going to reduce vertical segregation in the dependent employment and have positive spillover or second order effects on women's representation in entrepreneurship and innovation. Now, second policy implication we are like to offer and throw there for discussion is that policymakers should promote initiatives for desegregating fields of study in college, because segregation starts in college or gets started in college, right? We do know that women or girls tend to choose social sciences and humanities, whereas boys tend to choose science, technology, engineering, and math. So a policy implication would be that countries should try to increase women's participation in the STEM fields, hence increasing or paving ways for future women entrepreneurs in technology field, right? And hence increasing women's participation in innovation activities within entrepreneurship. Now, two more policy implications. Well, it's a stereotypical thing, and all of us, we are confronted with this, and many of us are parents, some of us are not, but we do know that gender stereotypes get established at a very, very early age, right? So another policy implication that we're suggesting is that policymakers and companies should stop segregating boys and girls in education, right? For example, we do not believe, following research of others such as Dr. Halpern et al., who have published a very nice piece about the myth of the benefits of sex schooling, and that create arbitrary categories of us versus them, and not necessarily increasing the performance of girls in the schools. And this policy implication could be also tied with something else, which we are referring to as encouraging youth entrepreneurship among high school students, right? Hence promoting role model entrepreneurs early on. And finally, because the overarching topic of our symposium, of our panel, is about public policies, and I have conducted research with Professor Michel Boudic, a famous sociologist in the United States, and my colleague from Germany, Robert Strohmeyer, and that research has been picked up by Sarah Tabot, and this research has showed that, well, only focusing on public policies, focusing on public policies is a good thing, but public policies can be this double-edged sword, because public policies helping women reconcile work and family duties through paid parental leave and subsidized childcare are good for those women entrepreneurs, primarily according to our research, who are growth-oriented and innovative women entrepreneurs. On the other hand, promoting such public policies in countries such as the United States, could backfire, because this niche is usually occupied by self-employed women who offer their work to take care of their children and take care of other children. With that, I would like to show you the references that you are feel free to check out. And that was it. Thanks very much for your attention.
Vartuhi, thank you so much.
You're welcome.
Okay, great, fantastic. Okay, you never know what you're going to get when you're waiting for your panel to present, and I am thoroughly delighted with the three presentations that we had today. So just to summarize, Irene, I really appreciated the actual data you presented on not only what's available, but what's actually working. Mara, love the idea of caring work being a right, and the whole concept of mainstreaming that into policymaking discussions, because it's always been sort of this female ghetto where we're the ones having to solve all the problems here, but our solutions actually solve the problems for everybody, right? And Vartuhi, as usual, brilliant. Vartuhi and I are longtime colleagues, and her research is always spot on. I think sex segregation is something we really need to talk about, and listening to your presentation really helped me appreciate what I would expect to be a non-recursive relationship between caring structures and sex segregation. So in women's entrepreneurship, sex segregation is a huge problem. You know, the women-dominated industries or industry sectors have usually low barriers to entry, but you know, low capital requirements to start a business, but also have very high levels of competition and have very low margins. And so this is not a lucrative, so for those employer firms, which it's unlikely for women to start an employer firm, but when they do, they still tend to start it in these places. And so I think there's a lot of work that has to be done there. And I think as we develop better care work support, it actually will work in tandem with the STEM type programs in order to encourage women to pursue higher profit sectors. So that's something work that we can do all the way around the world. In my own research, I've done a lot of work with the Global Entrepreneurship Monitor data, so studying patterns of women's entrepreneurship around the world, and barely touched on the care work. I've done, you know, at least one published study where I was really looking at the amount of money governments spend. But looking internationally, I think what I'd like to leave everybody with is just this idea that when we're looking at comparative studies, when we're going beyond these like sort of privileged contexts, like the US, Canada, many European countries, when we're really trying to understand the differences across countries, we're looking at cultural logics. And for example, we know that in Scandinavia, the role of the state is very central to the care work problem. Whereas in countries, for example, like Italy and interestingly enough, Japan, they're very similar when it comes to cultural logics around family arrangements. It's all about the family. The family has to absorb this. And then everybody else is somewhere in the middle with, you know, some sort of a stacking behavior or a mix, right, of solutions. When we're looking at developing context, I think it's really important to keep in mind from a policy perspective that a lot of the initiatives have to focus on what Mara talked about around changing gender norms, because they don't have public budgets, right? And so these community-based programming is incredibly important, but the involvement of men is incredibly important, because you have to get the most often male community leaders to not only sign on or approve, but also to champion. And as they grow their public budgets, you know, the caring work is competing with things like telecommunications and roads and health and good water and all of these imperatives. So just be sensitive to that, right? That what's working in the United States, it's different across states, and other countries, it's also different, rural, urban, it can be different across municipalities, but the resource environment can matter a lot. And also internationally, we have, you know, the necessity entrepreneurship. A lot of these economies are small business economies. And so they're sole proprietorships or, you know, small market firms. And then that brings me back around to Irene again and the whole solutions. And the final thought I'll leave you guys with is when we consider what current benefits are available, we're also concerned with eligibility, we're concerned with uptake, because this is the problem we see in the first world, right? The men don't take advantage of the benefits available to them, so it all falls on the women, and that there is a stigma attached to taking advantage of these benefits that are made available. The final thing is employer firms. Most of these benefits are targeting large firms, and about half of the American workforce is employed in firms that are 500 people and less. The number of people employed in firms that have 25 people or less, it's really significant because those firms often can't afford to provide the benefits. We heard that earlier, right? This idea that entrepreneurs are struggling with how to even support their own teams. And they're usually under federal laws in the United States, not even required to offer these benefits because of the inability to the burden that it imposes. So those are my comments. I think we've got one question in the Q&A that I'm going to put out to our panelists to respond to. And you're certainly welcome to respond to any of my comments as well. I was mostly trying to summarize. So I think the question here, it was, first of all, congratulations to everyone for the inspiring presentations. And our anonymous attendee here says, I am wondering at what extent some of those policies can be regressive. In other words, helping more the wealthiest people. Care services and infrastructures that free 1 hour to a highly paid person could result in a higher rent transfer than to lowly paid people. Do you think this kind of measure can increase inequality? And so I think that's really important. So to the panel, who wants to go first? What's the relationship between inequality and these care structures we're trying to put in place?
So,
do I have a volunteer?
I can go.
Okay.
So I think this is a really important question because it's often sort of sidelined in this policy discussion. So the question of workers, right? So one aspect of this is rights to organizing, right? We know that in some states, for example, in the US, childcare workers don't even have the right to organize. The other thing is with a greater role of sort of public provision, there's also a chance to greater oversight or regulation of working conditions and earnings, right? So when childcare workers are not only organized by unions, but also protected by stronger labor market regulations. Yeah.
And that's a challenge from an entrepreneurship perspective, right? Because unions have there's very little collective bargaining, very little involvement, because these are typically very vulnerable firms, especially for women entrepreneurs. And again, we're thinking like 25 employees and under. You know, again, if we're looking at women's entrepreneurship, this is 90% sole proprietorships in the U.S. and that trend is very similar across all other countries. In fact, it's a lot higher in less developed countries where we have a higher participation rate. So I think there's a lot of work that we would have to do when we're really thinking about the types of solutions that work for large organizations compared to these new and small organizations, because we're really facing employer constraints. And then it's time to wrap, but I'm going to leave one final comment on public support for those sole proprietors. This is something that Sue Marlowe in Britain has done some work on and is worth looking at, because she and some of her colleagues have put out a big call for programming, subsidies, other types of programming that can specifically help female founders, and that could actually help them figure out how to help their employees. So at this point, I want to thank my panelists. You've all made some wonderful contributions today. You really did get me excited. I was like, you know, here goes the conversation. We're always talking about the same things where childcare is concerned, right? But you really, I think, brought some really important new data. And so thank you very much. And I'm going to hand the microphone at this point back to Jessica. Looze, right?
More
than one Jessica on the panel here. Jessica Looze.
Great. Well, thank you so much. And I just want to say a huge thank you again to all of our panelists who've taken time today to share and just really raised a lot of interesting questions and great discussion. I just really, really appreciate it. And I also appreciate all of our participants. We've had some great questions coming in, and I appreciate you all being here today as well. I want to ask each of you to mark your calendars for our next Entrepreneurship Issue Forum, which will be taking place October 29th, Thursday. And we'll be taking up the topic of health and entrepreneurship, thinking about physical health, about mental health, about healthcare and health insurance. So it promises to be another great discussion, and I hope to see many of you here to share in that with us. So with that, we will conclude and enjoy the rest of your day, everyone.